I call this meeting to order. This is a meeting of the City of Berkeley's Reimagining Public Safety Task Force. Today is Thursday, July 8th, 2021. The time is 6:03 p.m. Pursuant to Section 3 of Executive Order N2920, issued by Governor Newsom on March 17th, 2020, this meeting of the Reimagining Public Safety Task Force will be conducted exclusively through teleconference and Zoom video conference. Please be advised that pursuant to the executive order and to ensure the health and safety of the public by limiting contact that could spread the COVID-19 virus, there will be no physical meeting location. To access this meeting remotely, you can use the internet through PC, Mac, iPad, iPhone, Android device, or any other device. Use the link provided on the agenda, posted on the city's website, or you can dial in and use *9 to be recognized if you'd like to raise your hand for public comment. Let's proceed to roll call, please.
Commissioner Fine,
Here.
Commissioner Jigu,
Present.
Vice Chair Chima,
Here.
Commissioner Blake,
Present.
Commissioner Linheim,
Present.
Commissioner Dangerfield,
Present.
Commissioner Ghosh,
Here.
Mr. Hyde,
Present.
Commissioner Malvito is absent. Chair Mizell,
Here.
Commissioner Opton,
Present.
Commissioner Harger,
Present.
Commissioner Diaz.
Good afternoon.
Thank you. Good afternoon. Commissioner Lutzker,
Here.
Commissioner Held. Thank you.
Okay. Do we have any hands for public comment at this time?
I just want to know what our quorum is now. With fewer members, what is our quorum now? For subcommittees, especially.
For subcommittees, there's 15 members on the task force, so anything that is 8 and above is a quorum.
Okay.
Yeah, looks like we have one hand for public comment.
I'll let the person in. Mark, nice to see you. You're free to speak.
Hey, thank you very much. Thanks, everybody, for your work. I have to say, so far, I'm really kind of disappointed in what I've been hearing from this task force. I think everybody's there with a really strong intention to change things, but there's a lot of shoe leather that I'm hearing from the police. These interminable, presentations that don't really shine much light on how things can be different. It sounds like a lot of, everything's going just great. That's not what I want to hear. And I certainly don't want to hear, these interminable, just sort of, chapter and verse about, police procedures and policies. I want to, it just feels like we got to get to the bottom of something here. And I feel like National Institute for Criminal Justice Reform, why are we not hearing from Cop Watch? Why are we not hearing from diverse voices in the community around all of this stuff? Why are we getting a budget the day before that there's going to be a presentation on it that people can't make hide nor hair of? What's going on? This is not a time-killing exercise. This is about trying to find some really new procedures, some new pathways that we can pursue here. So I just want to refocus everybody on what the intention is of this whole thing, and not just, let's just get bogged down in some more, palaver. Thanks, everybody.
There are no more raised hands.
Thank you. let's go to approval of the minutes, and then I can make a motion. Okay. Any concerns, comments, objections to approving the minutes? I guess we have to do roll call for this too. Okay. Yeah, let's call, I guess, the vote then.
Do we have a second?
First and second.
Who seconded?
I can
I'm
second.
gonna need a second. Thank you.
Thank you.
Thank you. Commissioner Fine,
Yes.
Najigu,
Yes.
Chima,
Yes.
Blake,
Yes.
Linheim,
Yes.
Dangerfield,
Yes.
Gauche,
Yes.
Hyde,
Yes.
Mizell,
Yes.
Chair Mizell, thank you. Upton,
Yes.
Harger,
Yes.
Diaz,
Yeah.
Lutzker,
Yes.
and Ho is absent. Thank you.
Thank you. I will now make a motion to reorder our agenda here and place the specialized care unit update above the police department budget review and response. We can have discussion if needed, but if not, a second would be helpful.
Second.
Thank you. Any discussion? Seeing none, let's go ahead and call the vote.
Just to be clear, was that Blake who seconded the motion? I'm sorry.
Yes.
Okay, thank you.
Yes.
Thank you. Calling roll. Fine,
Yes.
Najigu,
Yes.
thank you. Blake,
Yes.
Linheim,
Yes.
Dangerfield,
Yes.
Gauche,
Yes.
Hyde,
Yes.
Melvito is absent. Mizell, Chair Mizell,
Yes.
Upton,
Yes.
Harger,
Yes.
Diaz,
Yeah.
Lutzker,
Yes.
and Commissioner Ho is absent. Thank you. Motion carries.
Thank you. Moving on to subcommittee reports. 100% sure which subcommittees met this past week or two, but I guess we'll start at policing budget and alternatives to policing if we have anything.
We didn't meet.
Okay, community engagement.
Yeah, we haven't met either.
Okay, improve and reinvest.
Yeah, I'm gonna just say a little bit, and then if one of our subcommittee managers wants to continue, that would be great. We are mostly looking at, we started out with the reduce, improve, and reinvest, but realized quickly that we're really focusing on the shift from policing to services. And each person in the subcommittee was able to talk about what areas are of importance to them. For instance, like Alex Diaz talked a lot about reentry and violence prevention and other communities that he feels need to be included in the conversation. We also talked about the significance and level of deprivation and poverty in Berkeley and looking at whether there are sufficient services in order to lift these folks up. And they're typically from also diverse communities. In addition, we're also thinking about the overarching approach to this, potentially in terms of prevention strategies, funding, and also looking at the current political process. And I believe, and correct me if I'm wrong, the National Institute for Criminal Justice Reform is going to be issuing a report shortly. Is that correct?
It was supposed to be June 30th, I thought.
No, I was
That's
going to,
correct.
okay. I was going to ask, I think Buna is here and Liza is here. They may want to also expand on what I had to say.
I'll just say a couple of things. In some ways, it feels that we are creating committees because we're feeling that we're not getting either the information or that we're not being heard. So we create a subcommittee where we all feel we can work together. But we also don't want to go through the process of having to request a lot of documentation from the consultants and from the staff, because we haven't seen what the staff is seeing. We haven't seen what the task force is seeing in reports from police. So we only see what we see at our meetings. That if we had access to what it is, where are we headed, instead of always, oh, SCU, Berkeley dot, check. We'll give that to the community. Community will be happy, task force will be done. I guess that's the gap that we're feeling. That was at least expressed by a couple of people. So our request would be, can we see any of the reports can we see any report that's been sent from police to task force, no, to consultants and to staff, but not the task force?
I apologize, Buna, but could you be more specific? Because I'm just not aware of any reports that have been generated for employees or for the consultant that haven't been shared. There have been discrete data requests from the consultant that we've responded to, but there's been no reports transmitted. So I'm at a loss to figure out.
I'm just sharing with you the discussion that was happening. And, we don't know that. You just told us that. That's great. And I think we do understand that if there's discrete information that they ask for, and you're to produce a report for them, for us to get that same information, would we have to then make a request to you to get? It might not be the same information, but it might be information we feel we really need, or reports that the city has done in the last 5 years that have been shared with them. Not what they're doing right now, not what you're doing right now, but I'm sure they were given a couple of boxes before they showed up. Or is anybody else who was at that committee say if I'm saying this correctly? I don't want to misrepresent anyone.
Yeah, I think there's two things. One is like, for instance, one of the older reports that we had and I had put out there for today was the Berkeley Health Status data report that looks at the significance of public health in the city of Berkeley and health inequities and disparities and social determinants of health. And then there's the upcoming report, which David just confirmed is going to be issued, I think, by the National Institute. Now, did I miss something else, Buna? I mean, I think those were the two
No, I
things.
think those were the things that came up.
I was not even aware of the report that you produced, Commissioner Fine, until you shared it with us. So again, I'm just at a loss in terms of
There's a lot going on.
if there's anything you all want and we can produce it from a public records perspective, or we can just grab it, we're happy to share. Just let us know what it is. But
okay.
But do we make every request through you or through division heads, or does all requests go through you? I'm trying to make sure our committee members are understanding our own process and your process.
I think with commissions, it should go through the secretaries. That's my understanding.
Yeah, that is how it's been.
But nothing precludes anyone from making a general Public Records Act request to the city for any department to respond. I don't want to say that you've lost that privilege. So you absolutely can do that as well.
Yeah.
Anytime.
Have you ever tried? How long does it take, David? Okay, that's our report, but we're very excited to start our work. We didn't make like, yes, this will be the design, but at least we all made our commitments of the pieces of the work that we're willing to do. And I think that in itself is a success for a subcommittee.
Yeah, members, feel free to share more if you'd like.
Yeah, I guess I'll just add, I think, Commissioner Spine and Chima summarized it really well, but I do think that a really important thing that we discussed, I feel, was that, we feel like we're hearing a lot about police operations, and that's been really enlightening. But, I think we all are here to reimagine public safety, not to necessarily like hear the ins and outs of the police department and reimagine in the police. It's really about public safety. And this focus on prevention is, I think, really what we all kind of came to, is that in each of our respective areas of expertise, there's just a need to think about, when it gets to the police, it's too late. And even if the police aren't the proper responders, it's still, we're still not focused on the preventative aspects of things. And I think that that's where we really are hoping to focus across our various areas of expertise. And Commissioner Diaz, I don't know if you wanted to add anything either.
Yeah, I guess it was kind of just along the lines, like kind of what Liza said, was just, trying to figure out a way to maybe bring in different individuals into this conversation that have maybe gone through, like, I was thinking of like Oakland Violence Prevention Center or stuff like that, just bringing different organizations, different individuals who have maybe already gone through some of these motions and already implemented certain policy in their cities, to try to get an understanding of what they did, how they reviewed stuff, and how they, I guess, just looked at some of the budgets and how they made those recommendations and stuff like that too, instead of it only being from the police department, because I feel like we're only hearing one side of the story. And like the individual who just spoke before us also said, it's important to bring in other perspectives and other organizations into the conversation about what this could look like.
Yeah, no, agreed. And that's a conversation we will start having today. A little later in the agenda, but yes. And anything else from Improve and Reinvest? No, all right, thank you. Moving now to alternative solutions to gender-based violence.
Renali, go ahead, because Francis is not here.
Yeah. I guess we had a couple of questions. The first one was, I think Francis and I had both assumed that we would be getting some kind of recommendations document to react to at some point, that all of the listening sessions and all of that was going into creating some kind of draft that we as a task force would review. And we were, for some reason, had thought that was going to be presented at our June 30th meeting, but nothing was mentioned. So we're like wondering, did we miss here, or what is the schedule and what is the end product that the consultant is going to be creating? Because I think at this point, we should all be on the same page about that, because I think what we're looking to do is add pieces to building that, and really the consultant is like bringing all those pieces together, and we're thinking we're building this one little piece that fits into that then comes to the whole task force, gets reviewed, gets shared with the public, and moves forward. So that's one question about the schedule and what the end product looks like. The second is, we were wondering if Holly Joshi from Bright Star, who has a lot of experience with the specific subject matter that we're looking at, if she could help us prepare for the sort of the listening session that we are planning to have with providers. we were told that she has a lot of experience with this, so we would love to have her expertise from the consultant team to do that. And then we are in conversations with Commissioner Fine about your comments. I don't know if Francis got back to you. We just met this morning, so she may not have gotten back to you yet, but we're developing a providers list and some questions that we will talk to you about. So in case that was you hadn't heard back yet on that. Yeah, so for me right now, I think what we discussed, these two questions would help us decide how to frame the meeting that we want to have with providers.
Yeah. Mr. Wright, do we have clarity on when Nick Jr. will be presenting these reports?
Cheryl, do you want to touch base on timing with respect to report on community engagement and that piece of it?
Sure.
Yes, I think that would be the first piece.
Sure. So we are waiting for the listening sessions to be completed to be able to give that report. We have a summary report on the survey. And then I know that Commissioner Malvito is hosted, I believe, one listening session today, and then they're hosting another one next week. And so when the listening sessions are complete, then we can complete the report on the listening session data and share that with the group.
Okay, thank you.
Sorry, can I ask a little bit more clarity, like how long after? So, and again, another question, we don't have our next meeting is, I think, July 28th. And if there's another time that we're going to be talking about this, feel free to tell me to wait to ask that question. But I don't see any meetings scheduled for us in August. It's recess. And I want to confirm that. And then are there meetings scheduled going forward? And at what point will we be getting, if Commissioner Malvito finishes it next weekend, are you seeing a month later, a week later, 24 hours later? When are we expecting the?
Well, I think that we need to wait for the gender equity and violence listening sessions as well. So when all of the listening sessions that the task force wants to hold are completed, then it depends on when we get the notes and when we can turn them around. It's a little bit difficult to give a 24-hour time frame. I think that Commissioner Fine is working on finalizing some of the notes from the listening sessions that she was able to hold. And then as soon as we get them from the task force, hopefully we can turn them around in a sufficient amount of time. It's not going to be months, certainly, that we can turn them around and share them with the group. But I think the intention was that all of the survey and all of the listening sessions would be complete before we shared information, so that we can consolidate that information and share the high level findings from each of those without having to do it twice. Does that make sense? And I think that the guidelines have been shared, that BRG, that Bright Star has been working with. So if there are additional guidelines that you would like for the listening sessions that you're conducting, I'm happy to work with you on those or connect you with Bright Star to see how we can help you in facilitating those. But I've been reaching out to all of the groups that happened to Commissioner Malvito and Commissioner Fine and your group to work on organizing those additional listening sessions. So I'm happy to help in any way that you need.
Yeah, the strengths that we have is that we have a very good list. We're also hoping to and trying to get organizations that work with specific. So a listening session with 6 people from the community or 2 or 3 is very different from a listening session with, say, 10, 15 or 20 organizations. And then tell me if I'm wrong. Are you then expecting a report from us to you
right.
in time enough to become the first set of recommendations? Just give us that date, because our meeting is the 28th.
I think is it the 29th, David? For the 28th.
29.
We had listed the 29th, and we wanted to confirm that when we got to the end of the agenda on items for the next agenda, because we just wanted to confirm it with everyone. But then Commissioner Ghosh is right. We don't have a meeting in August because most of us will be on vacations. And then our intention and expectation is that we would meet, at our regular meeting schedule until the final report is adopted by the task force.
Okay, so
I guess my question was, I think we used the 28th as the community listening session. Let me make sure that Bernali thinks the same thing.
I am not sure.
Okay, so somewhere in the next few weeks, we're going to, so we will get our findings, our listenings, to you as quickly as we possibly can. Also knowing that we're going to be a small piece of this big piece, that they can start working on the big pieces and then they can just slip ours 2 days later. And 2 weeks before the report is due. So
Exactly.
we're not
I think
asking you to hold anything up.
Exactly.
Go ahead. Sorry.
No, I was going to say the reason we're asking these questions is I think we had hoped that we could bring the organizations together to react to recommendations rather than source recommendations, because we expect y'all to have done, we expect to benefit from the expertise that your team is bringing. So that would have been ideal. Knowing that that is not I think listening sessions, however you want to define it, we could not call ours a listening session and just call it a subcommittee meeting. So I don't want to be held up by that. But so is there a recommendations report other than the community participation report? Is there anything else that's coming? Can somebody answer my question about what the end product looks like?
So I'll start off and frame it, and then I'll let Cheryl chime in for some of the specifics. So there are functionally 4 different reports that would be delivered. So the first one was 5. There was the work from the city auditor and the calls for service work, and she presented that back in April, I guess. And that's been updated, and I think we sent around that link. She made some adjustments to that report just the other day because of the work and collaboration with the police department. There was the new and emerging models report that we discussed as a task force, and that's been finalized, and that's posted on the website and was circulated and shared with the task force. Then the next 2 reports, one is a report framed around alternative responses, and Cheryl can talk a little bit more about thematically what that will touch on. Then there will be a report summarizing the community engagement, which I think we just talked about. And then at the end of it, there will be a final report that will be submitted in draft form to the task force. And then once that's finalized, will become, the draft kind of roadmap and template. So those are the deliverables that we have that we're kind of tracking on our radar screen.
So I think, Barnali, to your question, I think it's a decision for the task force or for the subcommittee as to whether or not that listening session influences the final report, or is it the way that we're doing the zip code specific listening sessions, that it will be a response to the final report. So I think that is a decision that your subcommittee can make. And I think either one is fine with us. I think if you would like it to wait for the final report and to be a reflection on the final report, I think that's something to talk about. And maybe that can be covered in zip code specific listening sessions. But Una, you seem to disagree with that, yes?
I don't think we need to go that far. As long as the recommendations that each group makes, those recommendations, I believe, do need to be in the last report. Not just talking about us little subcommittee, but each subcommittee's recommendations, if they match with the recommendations of Nick Jr., check off. Great. If they don't, we need a way to see how we come closer together. Because it'd be great to have one report consensus on all the, but we can't really do that until all of us talk about each report and then vote on what we want in the recommendations as a task force first, and then give our recommendations to the consultants, and they just put them in. They don't have the right to change them or rewrite them. These are recommendations coming from the community, which is where we're supposed to be doing the deep engagement. And how can we leave their recommendations out of the very report we're doing for? We can talk more about.
Well, right, and I think I was hearing Commissioner Ghosh talking about wanting the listening session to respond to a report. But if the report is about listening sessions, I don't know that it's possible to have a report done after each listening session and then another listening session and then another report and another listening session. So
No, that's not what we're saying. Sorry.
I think we were trying to figure out the best use of the time of the providers and us, and you're going to ask for comments from us on the draft report. So we were just going to do that as a group on that specific subject matter. But this is helping a little bit in understanding that the schedule is not set in stone, and so we'll figure out how we want to proceed. I will say things are still not fully clear because I'm not seeing where the synthesis is happening, and is the synthesis not happening till the draft roadmap? And I'm hoping there's a final piece of that. The roadmap has all these recommendations, and there's some synthesis that's going to happen if there is conflicting information or there are gaps.
Right, and I think that's why we were hoping to have all of the listening sessions completed by July 16th. And I know Commissioner Malvito had reached out to me and asked for an extension on that. And we have extended the deadline for listenings. I mean, the original deadline for listening sessions was June 30th. And then we extended it to July 16th, and Commissioner Malvito had asked for an additional extension, which we had granted till the end of July. So then if we can gather all of the information from the listening sessions by the end of July, then those will be able to influence what goes into the report, because we will hear from all of the communities that the commission has desired to put into the report, if that makes sense, the recommendations
Okay.
for that input.
Just so we can go on to something else, we will have a session before the end of July and get you our findings as quickly as possible, because we're not doing that big deep dive into our populations because there's too many different kinds of us. So I will talk with Francis and with Bernali, we will figure something out. If we can be assured that when staff or the consultants owe a report to us, that we get it on time also. So we can't have double standards. We're in this process, we're going to be making room for each other. And now the deadline seems like it's going to be November. So let's just be respectful all the way around in terms of timelines, how much leeway there is, and what is the real calendar now with this extension. So we will deliver our part. And Bernali, you and Francis can talk to me about having promised that. But I think I have
We can, because Francis is not even going to be at the July meet at the end of the next meeting. So
no, we'll do it long before that. We'll start tomorrow. Okay.
Great. For commissioners with questions, I mean, does it regard the current subcommittee report? I know that's the item we're still currently on. If not, I'd ask that if it's more general, we can discuss it at items for future agenda.
I just have a point of clarification.
Yeah.
It would be really helpful. There's an update for the timeline of listening sessions on the website. If we could just keep that timeline updated in real time, then we don't have to have these conversations. And I do want to give Cheryl a huge amount of credit for being there. I mean, she's really supported us. And I can understand that Hector needs additional time because I don't think I've had enough time with one of my populations, and I know the other consultant has interviewed with some of the folks in that one. So it may take a little longer to get folks together to get feedback in the communities. And my only other question is, are we going to see like a draft of the final report before the final one is issued?
Yes.
And have you folks decided how it will be presented to the community, larger communities, so they can have feedback, so we can have feedback from people who didn't answer the survey, who don't really want anybody to show up and engage with them over certain questions that they don't want to answer. So all kinds of things are going to come up. So I think a little more flexibility.
Yeah, so we were asked in discussions with council, we were asked if there would be flexibility to do town halls potentially with each council member in their districts with the report to get feedback on it. So that's something that we've been talking about with the National Institute for Criminal Justice Reform, and they seem amenable to it. So if the council members want to go for it, we're going to, obviously do our best to support them in that.
Okay. So David, one other question. At one point, we had talked about, can we invite task force members? Hector doesn't have time to do that. So a few folks that are interested, Brown Act and all, can attend and learn from the current listening session. So when we do our caucus or whatever we're going to do, that we've sort of learned something. I didn't learn anything from the one I went to, which was the DBA one. But then I shouldn't be the person saying that because I'm not that new.
Yeah, I'll defer to Cheryl on that. I'm not really very much coordinating or close to the listening sessions themselves. So I know some are done with very specific targeted groups. And so there's sort of that notion of safety, but I'll defer to Cheryl to talk about it.
Yes, I agree with that, is that I think the listening sessions have been meant to be a safe space for these vulnerable populations. And so I think the DBA one might have been the sort of most public one to attend. But I'm happy to work with you on kind of questions or guidelines you like, and or help you facilitate the listening sessions to make them the most impactful. I know there's a great deal of sensitivity, and I know in the listening sessions that you're having other people attend wouldn't be appropriate either. So I want to respect the vulnerability of each of the populations in doing these, but however we can help you answer questions or have clarity or facilitate them, we're happy to do that.
And then there was, because some listening sessions staff is present. In others, it seems like staff is not present. So we're trying to, we made a request for a certain person to help us put together quickly this week, next week, the framework of what will get us the information that you guys are seeking, or the city is seeking, or we want to know. So can we have, oh, I forgot her name, Bernali?
Ali Joshi.
Ali Yoshi. Yeah, I will have to check with them because I know that BRG's contract was finished on June 30th, which was the original deadline for community engagement. But maybe Buna, and Commissioner Chima and Commissioner Ghosh, we can connect offline and talk about what you need and how to help you get what it is that you need to be most impactful.
Commissioner Opton.
I'd like to return to something that we were discussing at the beginning of our meeting. Mr. White mentioned 5 reports: the city auditor's report, the new and emerging models report, the alternative responses report, the community engagement report, and the final report. Now, we all have, or can have if we want, the city auditor's report, but I haven't seen any draft of the other 4. So I want to ask Mr. White, what is the current status of these other reports? Are drafts available? If so, are they available to us? And have any of them been completed? And of course, when can we have them?
So for the new and emerging models one, we talked about that here on a couple of occasions, and the final report is up and available on the task force website. And I think we distributed a link to the task force a week or so ago with it. I don't recall specifically, unfortunately. I'm sorry, but I can dig up my emails. The other ones aren't, there's no drafts available for the task force at this point in time.
Do you anticipate that there will be before this whole process ends?
Yeah, so I would envision hopefully at the end of July, again, I don't want to get ahead of Cheryl, but I think the hope would be that we'd be able to talk about the community engagement report and the alternative responses report then. But, you know, as we heard from Cheryl, it kind of depends upon the timing of the community engagement work. So that would be expected.
And then,
hopefully when we get the fall, we'll be able to get into the actual draft final report and the final report itself.
Mm-hmm. And the new and emerging models report, could you say again what you said about that? I didn't catch it.
Sure, I'm sorry. That one I know we talked about, I think on 2 occasions with the task force. Nahali presented it from the National Institute for Criminal Justice Reform, and then the final report, which was finalized after the second meeting, was posted onto the website for the task force. And I believe an email was sent out providing everyone in the task force with the link.
On June 29th.
Oh, thank you, Shamika.
Okay, well, I'll get in touch with you after our meeting about how I can actually get to see it.
Ned, I'll email it to you after this meeting.
So I didn't hear you, Boona.
I will email it to you after this meeting.
Oh, thank you so much.
Commissioner Lutzker.
Yeah, I just wanted to follow up with you, Cheryl, about something you just said, which is that the BRG contract ended June 30. So I'm a little bit concerned about that because of the fact that we have yet to see any draft of the community engagement responses. And my concern around that is that they, I believe, are the lead group on the data analysis, both quantitative and qualitative data analysis on that. And I'm concerned that with that contract having ended, if we have any feedback about different ways in which we would like to see the data looked at and questions we have for further digging into the data, there seems to not be an opportunity to go back to that given the end of the contract. I'm wondering, David or Cheryl, if you can clarify how we can overcome that apparent obstacle.
Yeah, I think, go ahead, David,
Go
sorry.
ahead. No, I was gonna say that's a good question. I'll defer to you. I hadn't crossed that bridge yet, so I'll defer to you.
No worries. No, so they are pulling the reports together now from the survey. And so I think that we can certainly talk to them about having like questions that come up when we present them. But I think we had this extended period of community engagement. So that went sort of beyond their active engagement. But I would imagine that we can pull them back in if there are questions about the analysis. And so I wouldn't, they're not inaccessible. They haven't gone out of business. They have, but I think that there can be an opportunity, and we can explore what that looks like as far as questions about the survey results that we'll share when we do the presentation on community engagement. And then anything that you need from BRG, I would imagine that we can, work together to pull that back.
Okay, great. Yeah, thanks. And it goes beyond, I think, questions. It
Yeah.
goes to possibly reanalyzing some of the data and doing some cross tabulations with certain demographic groups and stuff that maybe haven't been done. So thanks. I appreciate that.
Right. And pulling raw data and figuring out the best way to move forward with that, whether, however we do that, we can help work that out.
Commissioner Ogden.
I guess the last comment for the moment would be that reimagining policing is an exciting idea. I'm really pleased that the city wants to see policing reimagined. So I have been impatiently waiting for an opportunity to read the ideas of people who are reimagining it. Myself, others, the police department, other parts of the city government. And I'm disappointed that I'm not seeing that or hearing it from myself. I'm disappointed that I haven't reimagined policing. I'm disappointed that if others have, I haven't heard or seen their work. But I'm still hoping that I will hear and see it and have an opportunity to comment on it or even add to it before this whole process is over.
Thank you. Any other comments for this subcommittee item? Okay. Seeing none, let's go ahead and move first to subcommittee discussion. If there's any discussion to create or modify any of our existing subcommittees. Seeing none, we can move to our discussion item, and we reorder the agenda. So we will start with the specialized care unit update from Dr. Varhus. So please take it away.
Good evening, commissioners. Good to be here with you tonight. Mr. White or Ms. Cole, can I have permission to share my screen?
No. You got it.
Thank you so much.
Thank you, Shamika.
Let me see. Okay, I am presenting very briefly a version of the slide I shared last time in the case that there are commissioners that weren't able to be present. I'm here to give an update on the specialized care unit design process. So just to remind folks, the project goals are really to engage in a deep community outreach and engagement efforts for the development of the specialized care unit, to better understand the experiences and perceptions of current mental health and substance use related crisis response options, to look at challenges and strengths of the current crisis response options, generate ideas for alternative approaches to crisis, and understand the real needs identified by the community for a safe and effective crisis response. And ultimately, we will be designing and implementing a plan for the best model for Berkeley, and we'll be implementing that plan in form of a pilot that we envision will become ultimately the base SEU from which we will continue to build off of. I will also make sure to share that part of the community engagement process also involves a lot of reaching out to other communities that have implemented other similar SCU models effectively, and using some of that best practice experience to inform our own approach. Here is the work plan overview. We started this project in January. It basically consists of project initiation, materials development, community experience, and landscape assessment, which we are heavily involved in right now, program planning, which we are initiating, program implementation, where ongoing communication throughout the project is very important. So I want to be real clear that there are many people in the community and many people on this commission who have been dreaming about a specialized care unit in Berkeley for many, many years. There is a lot of lived experience. There's been a lot of advocacy. And so from the get-go, it seemed very important that this was not a process that city staff alone endeavored upon, but that we would really leverage the existing wisdom in our community. And so we have formed a steering committee that is really leading this process. And while I help to facilitate that committee, it includes representatives of the Health, Housing, Community Services Department and Fire, and also includes a representative selected by the Mental Health Commission, the Berkeley Community, and the Berkeley Community Safety Coalition. And we are trying our best to make sure there is good communication between both the steering member representatives and the constituents that they're representing. So the project has been kicked off. The steering committee has been formed. We meet every 2 weeks. We then worked with a consultant on the project who is helping us to pull together all of this research and really create a story around what we need for Berkeley, which is RDA. We engaged in we developed a stakeholder outreach strategy. We developed interview questions. We requested data from multiple sources. And the consultant met with each of the steering committee members to really understand how they could contribute and what their passion and interest is and what they hope to see. Currently, we're involved in the community experience and landscape assessment. So we've worked with the National Institute of Criminal Justice Reform on including survey questions in the survey. We are conducting provider interviews and focus groups, CBO and community advocate focus groups, community listening sessions, community member interviews and focus groups, working to benchmark best practice research and interviewing with a variety of communities around the country, and reviewing documents. Our steering committee members many of them have been active in different ways in this process. So a couple of them have, for example, helped to create more handoffs to unsheltered people so that we could, communicate, assess, and learn from them. Some of them have been active in the listening sessions with other communities across the country. And so we're really working to leverage trusted partnerships among our steering committee members to do that work. That work will continue through the summer. And from that, they will begin to do more data analysis, really tell the story, not just about numbers and, people like as if they're sort of more objectified, but real stories around what really happens to people and how they experience crisis response to help our community really understand what that's like. They'll also, RDA will be providing some initial program recommendations, and we'll be looking to hear feedback from the community on those recommendations. And then we'll be implementing this, rolling out this specialized care unit. RDA will produce a final plan and report, but ultimately our community will be in charge of actually pulling together this specialized care unit. And then we are continuing to communicate, give progress reports on what's going on. So we have the bi-weekly steering committee meetings We have meetings with RDA, with City of Berkeley staff that are actually doing the administrative work to help support this. I've been giving regular reports at the Mental Health Commission. And here I am for the second time at the Reimagining Public Safety Task Force. So the biggest update I think that I have since I last addressed this task force back in May, and I'm sure many of you are very familiar with this, the City Council in its final budget allocated $7 million for programs to address crisis response. And of this 7 million, 1.2 million is allocated to address immediate needs while we complete the community engagement and design process. The reality is people need our help now. They are, there are needs both pre-crisis, crisis, and, we do have in the city a variety of outreach teams and, various organizations and individuals that really work to develop trusted partnership with both, unsheltered people and people at risk of experience crisis, and help is needed right now. So council really wants to both recognize and honor the process that community really wanted to see in terms of really getting out and talking to people, but also wanted to be able to provide some support on the ground. So some of the ways this money can be utilized is by expanding crisis prevention and outreach, by leveraging existing teams and CBOs and organizations such as the Suitcase Clinic, Lifelong Street Team, and others come to mind that already are doing work, but could use additional mental health supports and or substance use expertise and or other sort of basic needs engagement expertise. And then how do we could use it to enhance the service coordination between these teams, and then establish an alternative call in line for community members that are seeking assistance for themselves or for others. These were sort of the, as part of my administrative role, options that I presented for council in the process, but it is the SCU steering committee that has come together to really design what this will look like based on all that we have learned thus far. And so we have a subcommittee, steering committee members that will be meeting actually starting tomorrow to really sketch out what the design for this sort of, I guess we'd call it a an orientation into the SCU. And I will add that this SCU steering committee feels very strongly that with this 1.2 million, we can actually implement some supports that would actually grow into becoming the SCU. There really isn't an interest, and it's actually, people have been a little bit frustrated, but there's been thrown in this like potential for a, another thing while we're doing the SCU, and our steering committee. And I think our community feels really strongly that, like, why aren't we just doing something that becomes the SCU? So they will be sketching out a sort of outline for what that would be. And our intention is to convene our community-based organizations that really do this work and do it well and come together and say, what do we need? And let's do it. So that's kind of the plan right now. Hopefully that the design will be done, sort of the broad design will be done by our steering committee in the next few weeks, and we will be convening organizations so we can really get some support out there soon and meet the need. And that is essentially my update, and I'm very happy to answer questions. Oh, and I will just also add, I'm sorry, there are a couple of people on this commission that are also steering committee members, so if I missed anything, or misspoke, please feel free to speak up.
Luna? Vice Chair Chima, do you have something?
Lisa, it would be so amazing, and maybe this is in different pieces of the research. If we have and I'm hoping that we do, if we have a really good analysis of what works well in crisis response now, which is what RDA is also supposed to be working on, I think. and something to compare to. And then look at the 15, 20, and Mark and I, the list is even longer, projects that we looked at, engaged with, that if someone would just sit down and say, Seattle, this is what they do that would work great for Berkeley. Oregon, this is what they do that would work really well in Berkeley. Because we're assuming that all these folks haven't had a great deal of problems. Kahoot came on early on, but the others that are, contracts not agreed upon. I mean, all kinds of stuff happens in this work. But one place where we have the analysis of the current capacity of the city of Berkeley to meet the needs of the folks that we're talking about in the SCU. And then which models around the country have pieces that really fit our needs, and then design the program based on some analysis like that, or design part of it. And today I sent to David, and I know you guys haven't had time, the work that Elliot and I did for the mayor in 2017, and I forgot that we did that, and we did a deep engagement process. We also did a survey, so I've sent it out. Please look at it. A lot have changed, but some things don't. It's got some information and a different model of how to do this, which, it was out of the mayor's office, so we could do, we could be much freer. But do you think it's possible to do like a couple of pages of what's the best practice that would work in Berkeley?
Yeah, I believe that should absolutely be part of RDA's report and reporting. And, that is something that we could ask them to produce earlier. They're not producing reports they're producing sort of more of a final report and giving us progress updates. But I don't see why they couldn't, begin to sort of work on sort of what sort of that crosswalk is now. I can also share that Mark Staton, he gave public comment earlier. He's been one of the individuals that's been sitting and talking and engaging with these different communities, and has been, he's been sharing, like yesterday, he shared some really interesting updates about, some work they've done in Edmonton and Chicago and some other places. And so we're doing that research, but I could ask, RDA to prioritize getting that section of their report done, because it seems like it's something that can be, they've pretty much gone through a lot of different models.
Because we got a lot of information from police, from BPD, and I actually am one of the people that has appreciated the deep dive. They're, it's pretty much at moments I feel like, oh, I'm sitting in dispatch. Oh, I mean, they've let us see more than I have seen BPD show many other groups. So, for that, kudos. But recommendations they come up with, it's like, no cuts, and that we'll deal with later. But I just had to say that.
Thanks, Poona.
Commissioner Hyde.
Thank you, Dr. Warhus. I feel like this is such an important subject for Berkeley. And I want to ask about the opposite in a manner of speaking. So rather than looking, it's clearly important to look at what other cities are doing that could fit very well with Berkeley. But one of the things that you mentioned was leveraging existing resources and expertise. And I did my ride along today, and I'm surprised that I haven't yet heard a lot of discussion about MCT, the Mobile Crisis Team. And one thing I learned today on my ride along, and I did actually get to see an incident that included first the bike team of BPD, but then there was a further call to MCT. MCT arrived and looked really functional and necessary in achieving what appeared to be the best possible outcome, one of the best possible outcomes for this particular incident that happened this afternoon. And so I must have met upwards of 20 to 25 new faces throughout BPD. And for the folks that I had more than just a passing hello with, I have to say that almost to a person, every BPD personnel member stated that they have such a fine and functional and extraordinary working relationship with MCT, that they are so proud of the relationship they built. And I had not been aware that MCT has existed for 40 years, since 1979. So I realize that I'm really surprised that in the SCU conversation, I'm not hearing about MCT specifically. So I want to ask, are you looking at, ending that resource and it's done and now we're doing this thing called SCU? Or rather, is MCT situated within and is central and essential to the larger funding and the larger buttressing and scaffolding that's going to be built through a broader system that includes resources that MCT couldn't provide because they simply didn't have the budget or the staffing. So are we flipping a switch and ending MCT, or is MCT the heart of what we're about to be building?
Thank you. That is an excellent question, and I'm actually really glad to hear that you got to experience MCT in action. So the one thing that few people know about MCT was actually it was the first model in the country for responding to mental health crisis, and Berkeley was very innovative when it was created. I will also say that Jeff Buell, who oversees the mobile crisis team, is outstanding. He leads an amazing team of individuals. He's very professional. He works very well with law enforcement, with community agencies, with folks on the ground, and with fire. And so it is actually a well-led team. We have had pretty consistent over many years challenges fully staffing the MCT. It's very, very difficult work. Currently, of the full-time staff, there are 2 full-time staff. We are buttressing that with a number of hourly clinicians that are helping to support, but it's been a constant challenge around staffing and yet we are continuing to try to fully staff the mobile crisis team. We haven't really had conversations about if this is an addition to what we have for mobile crisis, or if it's something that goes away. We're nowhere. I don't think we're anywhere near there yet. I believe we will continue, and we have budgeted for the full mobile crisis team. The real challenge is that our mobile crisis team, in part due to some historic incidences, and in part just due to personnel, they will not go respond to a crisis without the presence of law enforcement. That is, there have been some challenges that have, for whatever reason, made that challenging for them. And so when we're talking about a crisis response that doesn't involve police, we need to consider other options. And I'll give a really good example of where we might not want to have connection to police. If we have somebody that's having a substance abuse related crisis of some time, and they're surrounded by a number of individuals that, for example, may also be users and have been just as involved, they may be reluctant to call a crisis response where the police may come out, and more likely to call a non-crisis response to get their friend or family member help. So we're not even at a place where we're talking about replacing MCT, but we're really at a place where we're looking at what might we do to encourage community involvement and action in situations that really don't involve criminal and don't present a major, safety issue.
I'm sure that the steering committee has the expertise to really guide this. But my hope after today's ride along is that the personnel and the infrastructure that have made up MCT over these many 40 years are recognized and viewed by the community as expanded. That we, it can take an awful long time to create entirely new infrastructures. And there are a lot of working relationships that are very solid here. And it sounds like to me, we'd be crazy to throw them out. So I'm just hoping that as we hear more from the steering committee, as we hear more from you, we hear how we are growing the MCT philosophy and then the tactical on the ground opportunities and supporting them with new resources that weren't possible before, but that MCT is more of a central part of it and not a forgotten or ended part of it. Thank you very much.
Thank you. I will let the staff know that you shared your that opinion because they work really hard.
And I would just add that if it's hard to hire for MCT, I suspect it's going to be equally hard to hire for the remit that is going to be SCU. So I don't think we save ourselves anything by just renaming it out there in the public. We're still going to ask the same type of intense work from these people, and we're going to expect a high bar. So at any rate, I just really support what MCT has done and how they can be at the heart of leading us forward.
Commissioner Harger.
Thank you. Thank you, Dr. Rahus, for this presentation. It was very informative. I just have two quick questions about funding. So I know that in the end days of the budget, it was hard to get good updates. So I have a lot of community members, and also I myself still have a lot of questions about the budget for this upcoming year. So my two-part question is, one, I believe that this funding came from the American Rescue Plan, if I'm still correct. So my question there would be, is there a plan for continued concretized funding or general fund funding?
I think that's a great question, and a lot of people obviously are concerned about that because of the timeline of that funding. I think as part of this process, we have to look at multiple funding streams to support the SCU. It's not going to be one and only. We are a covered entity. We do bill Medi-Cal for services. That's one place where we may be looking to build funding, leverage funding. We're going to have to create a finance model as part of this going forward. And there are some public sources that we do have access to that will help us long term. But we just need to build the fiscal model for it. Currently, by the way, the mobile crisis team is primarily funded by a general fund as opposed to other funding streams. And so it is actually worth thinking about a smarter long-term finance strategy for for SCU. And MCT.
And MCT. Fantastic, thank you. And then additionally, of the total funding allotted to the SCU, is any of that funding going to the police department, either in the interim between now and the creation of the SCU or in any other point in time?
So the funding that I referred to in my presentation was a carve out of 8 million. So 7 million really was geared toward crisis response, non-police crisis response. So that funding really is around the SCU and non-police. There's an additional $1 million that was allocated around community safety that I didn't bring into my presentation. But which Mr. White or the chief can speak to.
Got it. Thank you very much. Would it be possible to have the chief or Mr. White speak to that, or would that be out of order, Chair?
They can speak to it.
In the budget presentation, the chief is prepared to talk about it. So if you want to hold off then, she'll be outlining that as one of the budget items that was funded, if that's okay.
Yes, that works perfectly. Thank you.
Commissioner Fine.
Thank you for the presentation. And I think there's two things on my mind. I mean, first of all, I think it's really important for people to understand that mobile crisis response is a very specific kind of response. The calls go through the police public dispatch desk. The police go to the scene to secure it beforehand, and then mobile crisis clinicians make the assessment, potentially a 5150 assessment. And it is done very professionally, but for a lot of times it causes a lot of problems for people who are living with mental health challenges in the community. And the SCU is really a non-police crisis response that has the ability to assist this group of people in a way that the mobile crisis cannot. And of course, there are going to be situations where you have people who are aggressive or violent, and you may need a police response, but we most certainly need an SCU to help many people with mental health challenges in the community. One thing that I had brought up earlier this week in our meeting that concerns me is that the research for the National Institute for Criminal Justice Reform and the research going for RDA have overlap, where it is absolutely critical that policing interactions are gathered both from what we did last week, the peers listening session, which was all people with mental health challenges, talking about interactions with police, where the emerging themes that came through, we're dealing with the type of attitude of the people who appear on the scene, the role of de-escalation, whether people feel traumatized or re-traumatized, and all different kinds of important data which inform a nuanced response to mobile crisis. And it's critical across the board that RDA is collecting not only the mental health, substance use, and homelessness data, but also that from the people who are out on the street, they get all of the data about their feelings about police being part of these interactions. Because they are, after studying the data for the last couple of days and starting to draft a report, I can see how rich and robust the data is for guiding us as we move along. And I also know on SCU, you know, where they're gathering the police data for the mobile crisis team in order to make analysis of that and interviewing the police. But we need to find out from the people who are on the street, who are living with mental health challenges, what their feelings are. So I'm really hoping that that is emphasized to them. And then, of course, the National Institute and RDA are able to come together and meet where they have a lot in common and not just two different distinct existences. I just thought it's important for Reimagining to know this because they're so focused on policing reforms, but there's actually stuff in the SCU that pertains to stuff over here.
Commissioner Lindheim.
So many of my questions have been by other people, so I appreciate that. The big issue that was, I guess, troubling me is where does this SCU conversation fit into everything else, and whether it's the mobile crisis team or additional to or subsuming or, and it sounds like this is still to be determined. And so that's number one. And so still to be determined, that's fine. But it seems like a really critical question as to whether this is in lieu of mobile crisis team, in addition to mobile crisis team, in addition to other services, et cetera, et cetera. And there are any number of reforms, quote unquote, that are going on around the country, many of which don't even exist. So you take our adjacent city, for 2 years now has appropriated money for a macro program. And macro is a figment of imagination. And nothing wrong with imagination. We're reimagining. Reimagining is a great thing, but it's hard to learn from things that are figments of imagination. And I'm concerned. So I've spent quite a bit of time calling around the country, talking to different, both mental health and police departments as to what they are doing for mental health response, because so much of what people are generally talking about in terms of reimagining is dealing with mental health calls. And there's enormous variation as to what the right response is. Now, clearly police believe that mobile crisis teams really should just be expanded, that they have a good relationship with them and they should be expanded. That's not just in Berkeley, that's throughout the country. And in fact, few places around the country think that a non-police response makes any sense. That doesn't mean Berkeley shouldn't do that. Not every emergent call, whether 911 or X11, needs a badge and a gun. And often a badge and a gun may be the inappropriate response, and that's part of this reimagining process. But I think it's really important in learning from other places to not rely on secondhand sources. And the most obvious example is the vast amount of misinformation about cahoots and what cahoots is good about and not so good about. And because there's been so much propaganda throughout this discussion, that I think it's just really important to talk, in looking at other experiments, to look at and talk to the real people on the ground, both the police departments, mental health departments, and people who are really, as well as community folks, but not to rely on academics or propaganda reports or reports about things, because there's just a great deal of misinformation about that. So I would just be cautionary about that.
I appreciate that, Commissioner. One thing I would just want to add is that that's really important to be mindful of, is that there's no model that is effective that we have seen or understood where there wasn't some kind of collaboration with the police. Everybody on the ground needs to work together and trust each other, and everybody has different roles. And so to assume that there's like this SCU that's going to kind of go off on its own and do its thing, I mean, the police need to know that what they're responding to is still safe. That's still their role, right? And so it's sort of, or maybe it's not, maybe it changes with reimagining, but my point is, what I think Commissioner Hyde was speaking to was what clearly was a trusting relationship that worked well. And I think that no matter what we do, an SCU that operates independently is only independent as so far as they can pick up the phone and call if that is needed, or they can be called if that is needed. And so I really just wanted to share that. We're not trying to create something in a vacuum, but we are trying to create an opportunity for very, very vulnerable people to not be over traumatized or re-traumatized because of how we respond. We're just trying to be better at responding effectively. So I really, really deeply appreciate your comments because I think people forget that we're still working together, and that's how things get resolved.
I appreciate it. And, one of the problems, and I've talked about this in prior meetings, that one of the issues that we're sort of confronted with is sort of like in Ghostbusters, who are you going to call? And at the moment, we don't have very many people to call other than the police. And it may be that we can divine other people in addition to the police to call for certain kind of functions. And that may be one of the real outcomes of not just our process, but the broader process. And that would be a good thing. If we can provide better services than we're currently providing, then that's a good thing. Obviously, as somebody who has managed lots of employees, the issue of security is still going to be an issue. And, in the same way that the mobile crisis team no longer responds without police, following that incident 2 years ago, although I've gotten multiple stories from multiple people about what really happened. But that there's still going to have to be some protection for employees or security for employees, whoever they work for, whether it's NCT or SCU or any of these other kind of things, and that's going to have to be a concern. One other thing I would just raise, and one of the problems with the call for service data is that what the auditor did is went into the records to determine which calls ultimately turned out to be mental health related calls. It was not what came into 911 as a mental health call. And what police will tell you, and I'm just acting as a hearsay in this sense, is you don't really know whether it's going to show up on the scene. I don't know if that's completely true, but it's something to also take into account. So it may be that a lot of calls ultimately turn into mental health calls, but it's only once somebody shows up that one really knows that that's in fact the case. And so it's a little problematic in terms of analyzing data about what the appropriate response is, depending when in the process you determine that it's in fact a mental health related call. And so I would just offer that as just one additional comment. And then I would just confirm what Commissioner Hyde said, that I've probably now with this process talked to over, I don't know, probably 20% of BPD by this point. And I would say there's universal commenting and questioning, why not just expand the mobile crisis team? But I posed the same question to the mobile crisis team, and they said, well, we're having a hell of a time finding more staff. And so how any of these teams are going to be staffed for this really difficult process seems to me more than a trivial kind of concern. And so we can imagine all kind of things, but staffing them is still going to be a non-trivial issue. And obviously, you know that, and I just want to restate that. And I guess those are my comments for right now. But let me just add one more thing. I think the propaganda about, and I'm using that word, but let's just say the public information about a program like Cahoots and how it has misrepresented what Cahoots is really great at, and Cahoots seems to be really great at certain things, that there's just a misunderstanding of why Cahoots is really good, but what Cahoots does not do, and why it really doesn't substantially take away from calls for service of Eugene PD. And so I would just be, as you look at other programs around the country, just be mindful of a lot of programs are being, I'm already repeating myself, but a lot of programs are being written up about, being discussed, but some of the information seems to be not exactly as the people on the ground would characterize it. So I just want to make that clear again. But you've already responded to that comment. So
Vice Chair Chima.
I have a couple of they're experience-based comments. One is that once we make the decision as to where the SCU is going to be, whether it will be the city of Berkeley or fire or a CBO, then I heard you say we need to be able to, of course, ongoing bring revenue to SCU. We've got 4 programs in Berkeley that have their personnel offices set. They work like a machine. They all bill directly for Medi-Cal. I think 3 bill direct. So we also have capacities already existing So we don't have to start anything from scratch. So looking at the strengths, the city might have, some strengths, but a lot of people don't even know that CBOs, especially the federally qualified, those folks collect their own Medi-Cal. The county used to collect it all and then give us grants, but now then they said, now you also do your part and start billing directly. So just look at that. Look at, what is the community capacity to hold? Because an independent SCU, I mean, they would have to form a board, you know what I'm saying? It would take a year to just do the basic stuff. So this whole philosophy and that you have and the steering committee has, that yes, partnerships, collaborations, but somewhere the hiring, the personnel piece, the budgeting piece, the reporting piece is also part of this money. So not all 700 is going to go to services, but 22 to 23% is going to go to benefits. So I think we need folks to understand that. Thank you.
Thank you. Any other questions or comments, commissioners? Okay, seeing none. Thank you, Dr. Varhus.
There is
certainly
one raised hand, Chair.
Oh, apologize. Oh, for public comment. Thank you.
Yeah, I'll bring in Carol. Carol, you should be able to speak. Carol?
The timer hasn't started. Could that have something to do with it?
No. Carol, we can't hear you. Let me try promoting her to panelist and see if that helps. Carol, you're now promoted as a panelist. Are you able to speak? I will take Carol out, and if she raises her hand back up, Chair, we'll bring her back in.
Okay, and yes, we'll definitely hear a comment.
And there is one more hand up.
Okay.
Looks like it's a caller with the number 510225. You should be able to speak. Your phone looks like it's on mute.
Can you hear me now?
Yes.
Okay, so unfortunately, I'm under this Zoom situation where I'm doing this by computer and phone at the same time. Thank you. So first, I actually wanted to comment on the earlier point that was made about the report that was coming in from the consultant on the community engagement. And it just seems somewhat absurd to have a report that was coming in from a contract that ended at the end of June before you've had the listening sessions. It presents as if you're listening to people, but you're not hearing what they're saying if the community engagement report has already been done. But moving on to the mobile crisis, I want to speak highly in favor of mobile crisis. They've been very effective through the years. When I've observed them, the police have always been in the background. And it did not appear as if anyone was intimidated by the police presence. The problem was always that the police didn't come in tandem with mobile crisis generally, because mobile crisis was often understaffed, or they were always understaffed, and they were off on another call. And so if the police were in tandem. They wouldn't be the first responders. They would be there in the background, as they have been the many times I observed. The mobile crisis has always been extremely effective. The issue has always been that they are not available 24/7, and so the police would be there because they were not on duty, also because they were understaffed. They were always on another phone call. When examples have been raised, such as the substance abuse example, I can see where a small CBO might want to come out and respond, and it would be appropriate, but I'm concerned about the serious mental health crises and crises where there could be a potential issue of something exploding. I'm concerned about the man who laid down on Telegraph and was run over by the car. And these incidents are actually fairly frequent. And it was announced today that he died. And so I'm concerned about those incidents where the police might have to be there in the background to save lives. And in those scenarios, the mobile crisis and the police in tandem, where they only get involved when are absolutely necessary, is the model that works. And no matter what you do, you're always going to have some collaboration with the police. Cahoots collaborates with the
Ariel,
police.
can you please wrap up your comments?
Thank you.
Sorry, your time is
Thank you.
elapsed. Thank you.
Thank you.
There are no more raised hands, Chair.
Thank you. Okay, then thank you, Dr. Varhus, again. Certainly, I appreciate the presentation and hearing the work that the steering committee has done so far. Look forward to hearing more and definitely, figuring more about the component of how this fits with everything else, and how we can make these things connect in an effective way. So, thank you. We will now move to the police department's budget presentation. Chief Lewis.
So, Chair, I'm going to kick it off just real quick, and I'll be brief. So, we did send out very late, and I apologize for the tardiness of it. Just a super high-level summary of the police department budget for fiscal year 22. So as you may recall, on June 10th, the police department did come and present on its budget, which did include pieces of the fiscal year 22 budget in there, as well as some of the historical budgeting work. So what was presented, what was provided to you was, because of the timing of this, we actually haven't produced the final budgets based on council's actions, but basically what we've got for you are sort of the budget in two pieces. So what we sent out to you via email represents what we call sort of the baseline budget that was adopted by council. And so the total department budget in terms of expenditures for all the funds that are associated with the department was about $77.8 million. 69 million out of the 77.8 is associated with 73 million of the 77 million is associated with the general fund. And then the next largest allocation of resources is attributable to the parking funds. So we have parking enforcement officers that are associated with the parking meter fund, and they're paid for out of the revenues that come from the parking meter fund itself. The one point that I just want to make sure that everyone understands, there's a total FTE count in what was presented to you on page 1 that shows total department numbers of 288.20. That is the full staffing level, but that full staffing level was not funded by the city council. there are 30 positions being held vacant in the department. 23 of those positions are sworn police officer positions, and then 7 of those are non-sworn positions. So in total, in preparing this year's budget, there was about roughly-ish about 8.2 to 8.5 million of cuts or deferrals that departments across the organization were asked to make as part of this year's budget process because of our deficit. About 6.5 million of those cuts came from the police department this year. And that was done at the direction of our city manager because she felt strongly that we should keep those position vacants in deference to this reimagining process. So as we roll forward into fiscal year 22, whereas pre-COVID, the department had a sworn allocation of 181 officers, that's chief to officer. We're now down for this budget to 157. And those are allocated positions. That doesn't represent people on the street, which the chief could talk more about. On the second page of what was provided to you, there's a breakout of the department budget by division. So there's the Office of the Police Chief, Professional Standards, Support Services, Police Operations, and Police Investigations. Again, this was all stuff that the chief had talked about at the last meeting. So this just really gives you sort of the updated numbers for fiscal year 22. A couple of things to bear in mind as you look at changes or increases in the department. There are a few things that occur naturally in the process of budgeting in which are really just sort of a function of employment. So every employee in the city of Berkeley matriculates through a step system in terms of compensation. So typically for any employee, there's 5 steps, 6 steps in terms of employment. Let's say your starting salary is $1. Employees will move from that $1 to $5 range naturally. So there will always be increases in salaries to account for that. Also, the city did experience 2 significant increases, one attributable to our pension contributions, and that comes from CalPERS. And then we experienced pretty significant medical increases last year on order of about 16%. So you see that reflected in the budget as well. So those are some of the highlights. One of the other actions that council took was adjusting the overtime budget for the police department. So we've been engaged in some very significant, very detailed conversations with our budget and finance committee over police department overtime. And I know the chief talked about this before, but for whatever reason, I can't directly put my finger on it or explain. The department had been allocated an overtime budget, I want to say roughly, I'll just make up a number, but it's not too far from this, of about $2.5 million. Experience has shown directly that that number has been woefully inadequate for a department of this size. So last year, and this actually emanates from a question that came from Commissioner Lindheim, in December, we had asked the council to adjust the overtime budget to be more reflective of what actual demand would be. And so that's why, one of the reasons why their fiscal year 21 budget was adjusted upwards. And so going into this budget cycle, in order to have a budget that everyone could be held accountable to, we worked with City Council to increase the overtime budget from that base number of about $2.5 million. About $3.4 million was allocated in addition to that into the police department budget. I think based on history, the concern is that may not be enough. But we've got a process in place with council to come back to them in November or December of this year to have a conversation with them on actual overtime usage, events or incidents that have come up that have driven overtime so that we can reconsider that discussion with them. So that's kind of just a high level overview of what you have to look at. And certainly in future discussions, if you look through this, because it was provided to you at such a late date, again, which I apologize for, happy to answer some more questions. The second part of this performance is going to come from Chief Lewis, who's going to talk about, so in our budget process, So within the context of this budget, there are a number of things that are missing. Commissioner Harger touched on one of them, so we'll get to it now. Council allocated resources to a number of other items to the police department. Generally speaking, all in alignment, either with this process, with direct community concern or need that has come forward to City Council and which we were asked to be responsive to, or really resources that were allocated in response to either the City Auditor's report or the working group, which we received a presentation from before around fair and impartial policing. So Chief, I'll turn it over to you to walk through those items, and then certainly, Chair, we can respond to any questions that we can handle in this discussion.
Thank you very much, Dave. Good evening. Yeah, I want to touch briefly on a couple of the things from the budget, and then I really do kind of want to make some overarching comments based on the discussion that we had. I actually really appreciated that discussion that we just had with Dr. Varhus. But to start with the budget, the pieces of the budget that are really directly related to this work that were funded that I really do want to call out that we have talked to you guys about before, but I thought it was important to bear mention at least again. And that was we did receive funding for our work to expand our open data portal. You know, this has been something that has been brought up many times over the years about the way we share our data, the speed in which the totality of data that we share and the transparency around that. So we feel very strongly that that's important. I feel that strongly that that's important and hope that very soon you'll see some real tangible changes to the data that's available on a regular basis. And the other piece that was funded was the funding to expand our bike detail resource. That's again been something that's directly related to our ability to deeply engage with the community, to be more problem solving oriented, and to ensure that we can make real connections and address problems that are coming up in our community that create a very direct connection to community safety. And I know that there was a question earlier about the funding that we did receive related to community safety from the $8 million from the rescue funds. And that money was primarily directed to the two analysts, the analysts that we talked about earlier that are going to be internally working to help not only our work in responding to the Fair and Impartial Policing Task Force recommendations around evidence-based policing, but to also take a real hard look at the way we collect data, what data we collect, to make progress in the areas of ensuring that we don't have questions that we can't answer or don't understand, and really are able to understand what we're looking at and adjust our deployment levels and our staffing levels and our responses in accordance with that. And another piece directly related to what I see as this overall work was an additional money for funding to continue our focus in the areas of fair and impartial policing, principal policing, implicit bias, transgender awareness, profiling issues, tactical de-escalation. You know, there's a handful of things we've really identified as important training topics that we want to continue to move forward on. And so having that additional funding to direct towards those things is really, really important to me. And finally, we did also receive some funding to continue our work with wellness for employee wellness. Employee wellness is critical to us being able to do our jobs and do our jobs well. And that's allowed us to have contracts with outside services to ensure that our employees are as whole as they can be, you know, based on the circumstances of the work, the very direct traumatic work that we're engaged with in a regular basis. But, you know, what I really wanted to sort of talk about tonight with you all was an acknowledgement of a lot of the questions that have come forth through the presentations. You know, really, when we started this, you know, our plan was to come in for the police to come in maybe one session or two sessions, tell you how we're staffed and organized, maybe tell you a little bit about our budget, and then lead you to your important work. But really, for me, I felt it was important for you to really understand the type of work we do, the way we're organized, the way we deploy, our focus, our training, how we hire and bring people on, you know, how we manage and discipline and review and mentor and develop our officers. to acknowledge and call out the areas we could be stronger in, like engagement, our liaisons with marginalized and historically over-policed communities, to call out the things that we do want to work on. But I wanted you to have a foundation, and I think a lot of folks are getting that from the ride-alongs and the sit-alongs, but to have a real foundation so that as you make decisions around reimagining, it's not in a vacuum of not at least understanding our perspective, our view, and the way that we are looking at these issues. And I'm sorry if you haven't heard in my presentations or my statements that I'm not committed to reimagining, or that I say there's no cuts that could ever happen to the police that could effectively address these issues, or that every single mental health response has to have an officer at it. Those are just not my truths. Those aren't our truths internally as a department. We see very much the value in having a strong collaborative resources, community resources, safety-oriented resources in our city that sometimes will involve the police and sometimes won't. And we are in the position right now as a department, a 24/7 operation that's staffed up and situated that when there is no one else to call and there is a problem in our city right now, it's the police that get called. We get called for things that are not necessarily police related sometimes. And really our reimagining work is about, is that what we want our police department to continue to engage in? Do we want to explore standing up a new department division team to do that work? Do they need to be separated? Should they be together? I want to engage in that kind of conversation with this group and share what my perspective is, what my historical knowledge is. I've been in this work for over 22 years. I don't know everything. I'm learning every day. But I do bring a history and experience and a skill set. And when you ask me questions about what would it look like at a 10% reduction, a 20% reduction, and a 50% reduction, what I've tried to do in those to answer that is to share with you what we do, how we do it, the way we task our personnel out. And, if we have less of anything in any area, are we willing to accept or understand what the ramification of that might be? And so that when we make decisions and you make recommendations around what you want our personnel to be doing and how large you want our department to be or think it should be to be effective, that you have an understanding of what the implications could be. For, simple example would be, if we understand that our minimum staffing level to keep the community safe and have enough officers out is X officers. Now, I think there's a lot of room for us to continue to analyze our data to find out what number X really is. But let's just say, that's our primary responsibility, to make sure that if someone calls us and needs our help, we can be there. So if I know I only have a certain number of officers and have to staff to meet that minimum X, I'm going to have to pull people from some other position inside, whether that's, our training department, our bike team, our community service bureau who engages, our traffic bureau. So that's the push and pull, either the ability to respond or the quality of our response, or the ability of officers to really deeply engage or have proactive time to talk to the community and understand the community, to know where problems are. Those things start to diminish the less personnel we have. We are I think a department full of people who are really engaged in wanting to grow and be better and be different where it's appropriate in the ways we can, and here that we need to be, who understand a lot about the history of where we've been and the ways we need to rethink the way we do our work. And I'm hungry for this task force to guide us in the things that we should be looking at, so we can then get together and talk about how we roll that out. And an example of that is the work that's being done around traffic enforcement. We know that the data both locally and nationally has shown us that there's incredible disparities in traffic stops, that there's affected communities that are historically over-policed. And how do we address that? What are the tools we have to do that? We internally change policies, and change training and work on those things. We collect data better so we understand what's happening. We seek input from subject matter experts in the work of policing, but also those who have been affected by the work that we do. We ask for input. We seek to determine what engineering things can help with traffic related matters, with collisions, to reduce things in that sense. How do we pull all the tools that are available in the community together and to make a positive impact on that? And then how do we measure? What performance measures do we use to determine whether we've had a positive outcome? So that's how I reimagine us. I reimagine us identifying what the areas where we need to be better at. And then instead of being rigid in who or what or why, but that we are more flexible in understanding that what our common goals are and how we can get to those goals. So, I hope that through all these presentations, you haven't found me as disingenuous or disconnected or not interested in providing my input or our department's input. That's never been the case. I very much am interested and engaged in us continuing to be a nationally recognized city and department for all the things we do, which include policing. So, I know I have a ton of questions that folks have asked me. Some I can answer. Some are just our data that we don't have access to or I can't pull together with the staff time I have. But I'm producing a written document for you guys that you can look at and refer to. That I just hope will continue to be this sort of background, floor plan for what we do internally, so that to guide your work. And I want to encourage anybody who has not been on a sit along or ride along, please, we have prioritized task force members getting this accomplished. We think it's really valuable to provide insight. So if you haven't taken advantage of that, please do that. And I'm happy to field any questions I can answer.
Thank you. Commissioner Diaz.
Yeah, so I guess I just have a couple comments, man. The first is, I want to thank you for your presentation, Chief. And I really want to just, some things I haven't addressed, I've kind of been quiet about, is I think some things that we do need to have a conversation about is like the Berkeley Gang Task Force and stuff like that, right? You say that there's, you guys are taught to create separation and distance between individuals, but, on certain days, you guys have unmarked cars in underserved communities where you guys are, purposely, from my experience, it seems like you guys are racially profiling individuals and pulling individuals over for being in a certain area or hanging out with a certain amount of people or being in a certain group, from my experience. And these are some of the things that I feel like we haven't addressed. And this is kind of the reason why I wanted to talk about bringing in some intervention programs or some violence intervention programs where it's different individuals that are in the community. Because 9 times out of 10 individuals, they just won't want to talk with police officers. They don't want to give feedback. I've gone to communities where I grew up in, and I asked individuals to partake in some of these surveys, and they just want nothing to do with the police, the Berkeley Police Department. So, part of this discussion for me is for all the other commissioners on the task force too, is there's a large demographic of people that just don't pop up on data, and they never will, quite frankly, just to be quite honest with you, because of their interactions that they've had with the police department. And because I would say the fear of retaliation that might happen, if they do speak up. So for me, I think the conversation needs to be like, that's why I made the recommendation of having like other organizations, community-based organizations take on the initiative of how do we see this policing? How do we see it on this level where it's like some of those tasks individuals won't want to work with the police department, but we need to address some of those issues, right? We need to address some of those community issues going on. So, and that's why I asked you couple of times, how is your whole gang task force oriented? How is that specific unmarked cars, when they're in the community driving by, they're racially profiling people, pulling them over? From my experience, the probation department and things like that, they weren't official injunctions, but they were injunctions where I couldn't be in a certain area, I couldn't be a certain span within Berkeley. And it was like anything I did, it was an easy violation. Even if it was walking home from Berkeley High, I had to take certain streets. So I brought this up multiple times. And I just want to, give a little bit of my personal story to the group and also encourage individuals to really think about like other ways we can think of like some intervention where police doesn't take on certain roles and initiatives, because I don't think individuals from these low income communities and stuff really want to have those interactions with the police department.
Yeah, I really appreciate that feedback. I will share that we do not have a gang task force that operates. I know you're referring to historically what was our drug task force that used to patrol in unmarked cars. We no longer have neither a drug task force or a gang task force. But more importantly, what really struck me in what you said is that there's folks that aren't comfortable engaging with us and letting us know the impact of our actions, and so, I'm just like kind of thinking in my head, how do we connect groups so that not only can we know and understand the folks that we deal with in the community, but that they can know and understand us, and that we can understand in our policing the effect that it has, right? That we can have a true understanding that, an officer trying to do their job right understands that they don't, they seek a restraining order saying you can't walk down a certain street, thinking that they are solving some problem. For whatever reason they do that, doesn't understand the long-term implications, the fact that years later that's still affecting you, and that did it really have the impact that they thought or hoped it might, and not really understanding that your perspective in that. So how do we connect our community in ways that we can understand perspective, impact, and I'm absolutely 100% on board with figuring out, strategies for diverting, for harm reduction, for reentry. All of those pieces I think are critical to our health in our community as a whole. And that's work that we actively would be interested in being engaged with in the ways that it's most appropriate and most positive. So I thank you for raising that up, and I'd be happy to talk offline with you more and figure out ways we can connect.
Yeah, that makes sense. And I just want to tell you, like, personally, like, I'll give you an example, right? A hypothetical example, right? Say there's an individual in a household whose parents don't get along. There's a domestic violence case, right? The individual most likely is not going to call the police department because he or she does not want to see his or her parents go to jail. So then they just stay quiet about it, right? So, there's certain instances where I feel that police just can't intervene, because if they do, it's going to result in a criminal charge on a party's behalf. And that's where like the issue stems from. It's like, I know it would, in certain circumstances and instances, police departments do need to respond, but in other circumstances and instances, individuals need alternate services where they won't feel like they will be punished for asking for help. Because at times that's what it feels like, if there is an issue with a young kid in a home where there's physical or mental abuse, whatever it might be, that individual might not want to speak up because of the consequences that come from speaking up. So that's where like intervention programs would come in. But if it's absolutely critical or necessary for the police department to step in because that person's life is in danger or whatever, then so be it. But I think that's where like the interaction, and that's where like the separation between like what organization, what entity, what program, whatever it might be, is going to be responsible for managing and handling that.
Yeah. Thank you both. Commissioner Lindheim.
Can I just jump in here real quick, Nathan?
Yes. Speaking with that.
And so, Alex, I really appreciate you bringing up those points that you did. And just real quickly, I wanted to say, you mentioned and referred to working with youth, and it is tricky. I definitely agree with you. It's a combination of systems that are coming into play. And I know from having personally worked in that system that some of those situations are mandated reporting. But when we work with mandated reporting, we try to assess where the least law enforcement intervention is going to be and what the best law enforcement intervention is going to be, and what other programs, services, interventions we can refer to or bring into play in that situation to have us kind of be that back, kind of like in behind the scenes as best we can. But still, we need to work with those mandated reporters to address whatever the situation is. So sometimes those calls come to us and we need to make the assessment. But I hear what you're saying. I appreciate it very much.
Yeah, Commissioner Lindheim.
So, Chief, I appreciate your comments about not wanting to play percentage reduction games. I think you're making a mistake. And I don't think most of us on the task force understand what happens if there are reductions in police staff, what the consequences are in terms of how police are staffed, what the implications are going to be in terms of patrol, more particularly what the implications might be not on patrol. And so too much of the reimagining debate has been part of this percentage reduction defund debate, and as opposed to a substantive debate. And I don't think you have sufficiently educated us as to your point of view on the consequences of reducing police staffing. We might not agree with you, but I don't think you've made your case, other than to say it wouldn't be good, as to why you see it indispensable that current staffing be maintained, or something akin to current staffing be maintained, nor have you explained the consequences to us, at least from your point of view, as to what would happen if there were substantial reductions in police staffing. Now, two things are occurring at the moment. One, in the current budget, you're just maintaining the same number of the ones that existed in the prior year in terms of authorized funded positions. But many departments, yours included, are seemingly suffering some attrition, and you're going to be having to deal with fewer officers, at least until you can get more people coming in, if that's in fact possible. Now, up to a certain extent, to the extent that the council funds some of these positions, you can backfill some of the missing officers on overtime, because you already have the funding for that, and use salary savings. But at a certain point, officers aren't going to be able to deal with mandatory overtime, or not going to want to deal with mandatory overtime. And so I don't think we as a task force have yet understood from your point of view the consequences if in fact we recommend, or the council recommends, greater reductions in staffing that are currently contemplated. Now, in the current budget, there are no seemingly additional staffing reductions, but both the city council has, the whole process here was move toward 50% reductions. That's the charge that the council put forward. I'm not suggesting that that's in fact the right thing to be done, but this is what the council's charge is, and I don't think you have pushed back or been articulated to us what the consequences of substantial reductions would be in terms of policing, in terms of public safety. And I really would appreciate it if you could indicate those, your views.
All right, well, I'll take another stab at it. Let me see if it's more clear. So I can't tell you that automatically, if you reduce by 50%, that I'm going to cut X, because I'm not going to do cuts in certain places without talking to, the leaders in my organization, to the community, to the council, to the city manager about what can we afford to lose. So what I've tried to express to you is that we have set patrol numbers, and those patrol numbers are gauged by the calls for service and gauged by the what if. So yeah, sometimes they're not that busy. And sometimes if one critical incident happens, we lose all our resources and can't respond to another critical incident, like a balcony collapse, something as complicated as that, something as simple as 2 robberies at the same time, something like a missing elderly person with dementia, or a missing child, and anything else in our city. Those are extreme resource drains. And so if we don't staff for the possibility, and that doesn't mean we staff 100 officers every night just in case, but that we have enough officers to handle what we see as a call for service load. Now, what I've tried to share with you is that the primary responsibility of our department is to provide 24/7. If an emergency happens, we can get there and save lives. That's our primary mission. And so there's a lot of things that go into making that happen, to making sure that someone who might be engaged in that kind of behavior is held accountable, that series are stopped, that people are safe to exist in their community, to walk about. So a lot of the things that have risen up in our conversations about what kind of training do you do? What kind of engagement do you do? How do you ensure that bad officers are discovered and people are mentored? How do you ensure that good records and data is kept? Those are all the things that are done behind the scenes. And that's why I really spent the time talking to you about our Community Services Bureau, our Internal Affairs Division, our bike detail, all of those pieces. So you understood, I have a list that when I give you the written document, you'll see where I just highlight some of the things that you will lose, our agency, our department, our city will lose if I have to pull people from that in order to staff patrol. Our Community Service Bureau actively works with the community on problem locations, problem people, helps find long-term solutions, guides non-law enforcement responses, and helps be a part of that process. They're a direct connection with the community. So when problems arise, people can seek help and get detailed, immediate long-term help that a patrol officer doesn't have the capacity and maybe relationships built with other city departments to do. That's one of the places I have a lot of bodies. And if I lose too many personnel and I have to make sure public safety needs are met, I might have to shut that unit down and move those people to patrol. Our motor officers, they are regularly asked to deal with school zones, large trucks traveling in neighborhoods where on their way to commercial routes, making it unsafe for people crossing the street and walking around in downtowns. If I don't have that personnel to direct to that or deal with traffic issues around the 4th of July and make sure that Panoramic Hills neighborhood is that non-residents are kept out there because they've had fire issues with people on the hill. And there's no way we can do that without having personnel to do that and make the citations and do those things. But if I don't have the personnel to staff patrol because I don't have the staffing to do that and public safety needs have to be met, then I've got to shut down the traffic bureau. So that's the thing is I can't say or won't say without being thoughtful about it. Hey, if you cut us by 50%, you're going to lose this for sure, because that's a big decision. Those are meaningful, impactful decisions. If we no longer have the time and the space to follow up with a victim and make sure that they have information on restraining orders and that we go by once or twice more after they were victim of a peeping or prowling or burglary, to just say, hey, we're still around in the neighborhood, keeping an eye on your house. If we don't have the space and time to do that because we don't have enough personnel and any free space, there's a direct negative impact on our community. Do I have a metric for that? No, but that's why I try to show you sort of those gauges, the speed of how fast we can get to a call, how many officers can go to maybe catch an offender or ensure that they can get there and handle a scene and get statements and things like that. The quality and length of time we can spend on investigation. And to do that at the beginning so we're more effective in our investigation, but also save so we don't have to have as robust an investigative division so that work can be done. All those metrics where it's kind of give you a visual, an idea that if you reduced our staffing numbers, those things would go down. It might take us longer to get to something. If it takes us longer, you might say, what's the big deal? It's just a property crime. Well, something that's a property crime because we get there rapidly might have become a crime against a person, if the homeowner comes out because they don't want to see that thing happening. So they engage with the person doing that. If we don't get there in time to intervene, a disagreement, a disturbance maybe becomes a domestic violence incident if we can't get there in time to intervene. And so there are impacts and they're hard to measure sometimes. I hear that you want me to be more specific about the impacts. I'm sorry if the things that I was sharing didn't cover that. There's a lot of unknowns and there's a lot of risk. And we talked about this very much with the SCU piece. We have an MCT that's staffed. We want this other thing, this SCU. We can't just turn off. We shouldn't just turn off one thing thinking this is all ready to go. We need to talk about where we see as a city, a community, a nation guiding public safety, and figure out what things get turned or changed or shifted, and as other things are built up and developed, and so my fear is that we're so anxious to see this incredible, decimation of the staffing level of the police department as a moral victory. We miss out on what's really important here, which is keeping our community safe. So I don't know if that did better, or if you still really want me to be data driven, but that's really me speaking from the heart about why I struggle with trying to give you a really clean, easy answer to these questions.
I'll leave it at that. I think the issue is, I think there is an underlying premise to this process that there needs to be substantial reduction in policing. And I think you have a position that that doesn't make sense. And I just think it's important for you to articulate that position as clearly as you can.
Vice Chair Chima.
Yeah. Boy, so much information has just come in, and I'm so grateful for that. I think that when this legislation was passed, it's been a year now, the environment, the mood, everything was different. And there was a lot of pressure to make it so nobody ever got killed again. And I'm not trying to be rude or over dramatic or anything, but it was driven from a lot of community passion, which has always been there around equity and, you know, all the race issues in Berkeley, all of that. That was a very political legislation, and it was based on wrong analysis and some statements that now, looking back, I'm sure that Andy Green would say, "Oh, wish I hadn't said that." This whole 50% number came from the chief at a meeting making the statement that, oh, almost half of our calls are about mental health. So it was like, oh, if 50% of your calls are around issues of mental health or substance abuse, something, then 50% of your budget should be cut. It really was like that. And a year later, what I'm looking at in terms of figures, besides the fact that that the police budget goes up when a certain we have a particularly one kind of political council, and it goes down at other times because budgets are always political. To cut I feel that if you look at the last 6, 7, 10 years, and we look at last year's, was it 9% cut? And then having all these positions open because that there's, we can't hire anymore. We are almost at 50% cut in the police budget. Might not be 50%, but if we took all the things that we've said to the division, can't do this because, you overspend, and then the focus on the overtime. I think at some place, and I don't know who those people are, need to revisit that legislation. And that seems to be true now that we're halfway through this about a lot of things. So why have a listening session? Chief, this is not about police, but I just have to say this, listening session in every district, where if you take District 6, very little interaction with police happens. Why not more learning from the people who, have the most, interactions? So for me, it's like we're all working in a context that's like a year old, and we're being asked to come up with things. Let's have this, have a bunch of consultants do a bunch of work and quickly have a plan and says, we're going to make these changes, but we're going to keep cutting you at the same time. That doesn't organizationally, that does not bode well for the wellness of the community and the wellness of any organization that's an institution in the community. So I don't think anybody's going to want to revisit and say, oh, let's look at this. But I think chasing this 50% cut is the wrong way to go. And the chief is right. When, an organization finds out, oh, this year, we're going to cut your contract by 30%. And we want you to cut 25 beds. You can't just do that. So you have to go back and say, no, can't cut the 25 beds. We'd rather, here are the places we could make small cuts so that they add up to the amount that you want to cut us. But we can't cut whole programs because those needs don't go away. So this cut. I'm finding this conversation kind of like one that's gone awry. Is that an English word? Yes, awry. So that and on building your case, I think with all the things you just said, Chief, are the very things that you were actually speaking to us, answering Dan's questions, but you answered it in a way that you were building a case for why we need a certain amount. You know what I'm saying. But we're all kind of like stuck as to how we meet that legislation, and that gets keep thrown at us. Recently, it was like, Councilperson Bartlett said 100,000 for the SCU pilot. And all of a sudden people are saying, well, the SCU can only be 100,000 because that's what was said in the legislation. We've changed all of that, haven't we? So why can't we go back based on facts and say, I mean, you're cutting anything into half without having the other half in place, whatever that other half is, and whenever that place will happen, I think we're not having the full conversation that will bring us transformation, as long as we keep tying it into percentages and budgets and how many calls you answer to whom. So I'm just sharing my challenges as a task force. And it's like, oh, you're on the task force, you were appointed by a particular community or city council person to do this work of cutting the police 50% and replacing it with 100,000 pilot project. There's so many contradictions in there that it really needs to be revisited. I'll bring it up. But this conversation about the 50% cut is very uncomfortable, having run large organization with a union when your funders say to you, 50%, 30%, because we don't have enough money. So that's just how I'm feeling right now.
Commissioner Hyde.
Thank you, Chair. For one, I'll try and be brief because for once I don't have 5 back-to-back questions for the chief. So you're off the hook, sort of. I really wanted to respond to Commissioner Diaz's comments and Commissioner Chima's comments. First, Buna, your thoughts resonate so strongly with me today. And I wonder, my head has really been swirling since going on a ride along and really taking a careful look at, what at the nitty gritty level, at the super granular level, what's involved in the day-to-day patrol and also all of the backup systems that are supporting the patrol officers. I haven't done a sit-along yet, but there's so much else that that supports patrol that also looks really essential. And so, for us to be taking that somewhat arbitrary number of 50% and to hear from you, Buna, how that came up possibly, and why that's our target. My hope is that when we do our reimagining and we're coming up with final reports that we may, as a group, say that 50% number doesn't feel effective and right, but maybe there's a different number that does, and that there's going to be a lot of reasoning behind it, but that maybe we won't be beholden to that exact number. So thank you for saying something that really, really resonates with me today. And then Commissioner Diaz, I hope you're there, fella. I see your camera's not on, but I am so grateful for your specific voice, the scenarios that you detailed for us. I am so grateful that you're here on this commission and that you are in dialogue with your super important community and that you can bring to us what's on their minds. I just worry that there's not, you know, enough of the direct voice, and I'm glad for your time, and I'm glad for you being the voice for a lot of other folks. So thank you for bringing that specifically into the conversation and filling us in. And then the only thing that I would say to yet again advocate for all of us commissioners doing a ride along is that I know it can be seen as a propaganda opportunity. That's a strong word, but you know, the officer's opportunity to put on their best face. I found it very useful to ask super specific, hard questions where I could dig down again and again and again and question the answers that were coming to me in a way that I can't do here in a Zoom call. And so whether that interaction was with the actual officer who was driving the car or many of the other officers that I met and had a chance to really seriously press on some of these important issues that we're pressing on here and now. We just don't have a lot of time. These meetings can't go till midnight. I was really grateful to just have a chance to really talk deeply and look at the face of the officers who were responding to some hard questions. So that was my experience, and I hope that others, if they can make the time, would have the same. That's all for now.
Commissioner Fine.
Well, I just want to say first, I think that you really do come to the task force being very genuine and sincere. And I truly think that you're committed to the integrity of the police department and that you care deeply about it. I think from my perspective, you know, in all our different professions, we sometimes have underlying assumptions about them that don't always mean we have the same lens looking at things. Like I was a lawyer in child protective services. I represented social workers in child abuse and neglect cases. And I think the work that they bring to the table versus what the police bring to the table is not necessarily the same. And so there's some areas when I'm wondering about, like, if the police are the ones that should respond to some of these calls, it's more from this lens that I've spent so many years with social workers in really some of them very high profile cases in Philadelphia. And one of the things, like, I did the sit along, and I would love to do the ride along too, is just really noticed a large number of wellness checks. On June 27th, there were 233. And by the end of the month, I would imagine there are between 8 and 10 maybe a day coming in through the dispatch operators. And when I talk about, like, the lens that police see things through, I mean, you have a job to assess risk, to look at threat, because, I mean, this is people reporting crime. I mean, I don't think you ever intended to get in the business of mental health and substance use and all that or homelessness, but that's how a lot of the information is getting filtered. And so I'm hoping, like, with more disclosing of public data, that we can start, like, unpacking and fleshing out what these wellness checks are. And hopefully SCU, like, I was talking to one of the dispatchers that, you know, there's going to be the easy stuff to start out with. And that there's got to be some of that is a good fit even from the beginning. And with this 1.2 million potentially already, we may know some things that can be, you know, transferred over without a lot of, you know, debate. I also think, you know, in every profession, you have some people who are just really good at developing trust and rapport. And so you've got officers who can go down to the encampments and don't have a problem because they've really cultivated relationships with people there and can talk to them like human beings. And then there's some people who are really, really uncomfortable with mental illness and with people who are just absolutely collapsing on the ground due to drug use or homelessness, where they just experience ongoing housing instability, that maybe that beat on the ground is not their cup of tea. They do better in other kinds of roles. And we might need to be looking at that in terms of, you know, because there will be some calls where police have to respond. But how do we sort of look at the people who are on the force and the ones that actually can make that connection, that the safety of the individual with the mental illness is also considered, instead of feeling like everybody's dangerous or something like that, having more of a rapport and a sense of trust, so we can hopefully get that person to reduce their drug use or get them to do some medication assisted treatment so that they don't have as many cravings. I think those are goals that we can share. I also wondered, what's the content of the CIT training like? I mean, I know that peer specialists, for instance, have to do an 80-hour training in order to be able to go out potentially on a call and be there for somebody who is experiencing an altered state. And not everybody who's in an altered state is dangerous. I work in a public library. I've got 4, 5, 6 people with some level of altered states sometimes at once, and they're not violent. And I think there's just this huge stigma about people with mental illness and substance use. And so that's something we need to address, and particularly as it's wrapped up with race and ethnicity and LGBTQ issues, which makes it even more pushed out and marginalized. So what I'm hoping is, the one other thing I was going to suggest, I really think that these systems need to be meeting together, because they're overlapping the police and the human services and the health and the community services. And that's why I just keep honing in on the research, looking at these messy boundaries at times, and how do the people on the street inform us so that we start doing things a little bit better. I don't know, that's where I see more communication needed. So I really feel like you're genuine and you're just trying to bring us your A game, but there are things that we have to address from a lot of lenses.
Commissioner Lutzker.
Thanks. So I have two very different things. One might be a question actually for David White, which is, I'm wondering if you can provide some greater clarity around the funding for the parking enforcement officers and the parking fund. And I guess, and perhaps Chief Lewis, you can also provide information, but I think what I'm wondering is it the entire salary of the parking enforcement officers are paid for by the parking meter funds? What about the vehicles? If there's any excess funds, where does that go? If you could just clarify that, and then I have a second comment.
I'll clarify as best as I can, and I may need to follow up on a few things, but the parking meter fund itself, so all that revenue is generated from meters, and that funds not all, but a large majority of the parking enforcement officers and all the related equipment that they use. There are a handful of parking enforcement officers that Chief Lewis, I'm hoping, knows off the top of her head, that is funded, 3, thank you, that is funded through the general fund. And that's really been driven by the inability of the parking meter fund to sustain and support all those parking enforcement officers. I do want to point out there is the revenue that comes from the citations that the parking enforcement officers levy. That actually goes into the general fund itself. It doesn't go into the parking meter fund, so it's separate from that. I'm not sure that means much to me. I'm just wanted to make sure I pointed it out to you so you knew kind of how the difference in the streams work. Did I miss something in your question?
I guess I was just wondering about the little cars too.
And then
that-
I could maybe just to clarify or just to let you know, I'm finalizing sort of a 3-year look at data that'll show you the traffic bureau. I know that Commissioner Ghosh asked about the traffic bureau budget specifically, and so I'm just trying to make sure everything's in there that covers it. But I'll show you that the parking meter fund pays for all, but I believe 3 of the parking enforcement officers. They're funded through the general fund, and then the training and internal service costs for the majority of the parking enforcement officers is paid through the parking meter fund. The only thing that's a little sort of weird about it is that they share a building with the traffic bureau, so you can't really separate the sort of IT some of those internal service costs because it's a shared building, those resources are shared, but the parking meter fund funds not only the parking enforcement officers, but the parking enforcement supervisor and the parking enforcement manager. So that chain of command is part of the parking meter fund.
Okay, that's helpful.
And yes, all the equipment that would be associated with them is funded out of the parking meter fund as well, unless there was some financial distress that we had to address.
Okay, thanks. And I will say it is actually helpful to know that the fines and fees don't go into the parking enforcement. That's helpful information.
Okay.
The second thing is I'm just, and I'm going to speak here for myself, and I know that others on the commission may feel very differently about the role of policing, but I'm going to offer an analogy that I think helps me to think about what I at least am trying to see happen here. Because Chief Lewis, I hear what you're saying and I really appreciate it. And I understand that, I think that, you are doing the best you can and your officers are doing the best they can in many instances. And I don't think, and this 50% cut it is a challenge. The analogy that I would like to offer here is that there's a pool of water, right? And the pool of water is like dangers that people can fall into, and people can kind of wade through it, or they cannot, right? And the role that the police right now are serving is as the lifeguards, right? When people fall into the pool and they need rescue, right? The police are doing that. But what we're doing by funding all the lifeguards is we're failing to fund people to teach folks how to swim. We're failing to fund flotation devices for people. We're failing to provide things for people to hold on to physically so that they don't fall in, right? And we can't provide funding for all of that because we say, look, we have these lifeguards. These people don't know how to swim. They don't have things to hold on to. They have nothing to float. And if we take away any of the lifeguards, people are going to start to drown. And I think that that's true to some extent, but there has to be a point at which we say more and more lifeguards. And the thing is that we are in a situation right now in the United States and in Berkeley where the size of the pool is increasing, with inequities increasing, with affordability in the Bay Area just being out of control. The pool is getting bigger. And so we keep wanting to say we need to add more lifeguards, but we really need to provide these supportive structures. We need to teach people how to swim, provide assistive devices. We need to build infrastructure to keep them from drowning. And at some point, we have to start saying, let's stop putting more and more lifeguards out there and provide this assistance. And I hope that kind of analogy, for whatever flaws it might have, and I think it's the same, like swim instructors, you can have a pool full of swim instructors and there's still a lifeguard there, right? Like that's what we were talking about, with the MCT, or the SCU. We're still going to need to be able to have a lifeguard there in case something happens. But that's not what we want. We want people to know how to swim. We want them to have things to hold on to. And we need to say, yeah, let's cut 50% of the lifeguards all of a sudden. I also think that would be a mistake to do right away, but we can't keep saying we can't sustain more and more cuts to the lifeguards. We need to start investing in the other parts. So hopefully that's a helpful analogy to me. I hope that that can maybe help frame a little bit of like where at least I'm coming from in this whole conversation about what we think that, you know, and I think that's why we're frustrated a little bit. We keep hearing presentations about the lifeguards and what the lifeguard program is like and all of the great things that the lifeguard program does. But I think we want to know, like, what are the other things we can do? How can we make this better? And, you know, we have that report and from, you know, but that's kind of like, I think people are feeling that that's an inadequate way to approach this. And I think that's like, hopefully that's helpful. I don't know. Thanks.
Thank you. Commissioner Diaz.
Yeah, Liza, thank you for that. That was perfect. So I guess kind of what I wanted just to address was like, you know, she touched on it perfectly. Like, right, we've seen a huge spike in Berkeley in crimes, especially over COVID, which means that there's a lot of equity injustices. And those equity injustices do feel, you know, they're the main determinants in whether crime rates increase. If people have less resources, they're going to go, like you said, you addressed burglaries. They're going to go commit burglaries. They're going to do whatever they can to get a job, to get money, to get support, right? So all that to say, I just wanted to address, like, you know, on the side, I do case management, reentry work and services with youth that are at youth prison. And we got a county contract through the Alameda County to work with Alameda County youth in these youth prisons. And many times the youth that, you know, end up doing these crimes do have mental health issues. They do have or they have some type of, you know, family issue or family struggles or come from a broken home, whatever you might call it. And many times it takes other individuals that have come either from their own particular situation to come and address and help them address those issues. You know, if we were an organization that came and we had, you know, Alameda County Police Department or Sheriff Department or something on it, 90% of our applicants would no longer participate in our program because we had a police badge on it, you know, and those are the same individuals that, you know, they start when they're young, right? They're 14, 13, 15 to commit some crimes. And as they go on, they become worse and worse and worse over time. So like Liza said, it's really impactful that we have individuals that maybe have made some mistakes in their lives, but have also been able to overcome those challenges and now go back and run and kind of teach those programs to individuals to hopefully stop that from them committing more and more crimes and getting more and more violent. So that's just something I kind of wanted to say and touch on was like, you know, I do appreciate the work you do. I know there are some absolute, you know, areas where we do need police. I'm not saying that, you know, we don't need police at all. You know, I just think it's important for us to look at like, what are the necessities? What are the crimes? What are the areas? What are the times that we absolutely need police? And then what are the situations and areas where we don't, where we need other individuals to come into play, or we need other individuals to come and try to intervene, just like Liza said. And you know, also, I spoke with somebody else today that was a part of the $18 million reallocation from the city of Oakland. And you know, one of the things he told me is like, you know, what are vital public safety services that we need, and what are their impacts that they have in our community, right? So from Oakland, it's going to be different, right? Oakland needs different violence. They need more violence intervention, more violence prevention, more gang intervention and stuff like that. I think it's important for us to look into areas that Berkeley needs more help and support in, whether it be educational gaps that we need, whether it be youth programs, summer programs, you know, whatever it might be. And, you know, I wish Hector Malito was here, was because I feel like he could speak to this too, whereas there's also this lack of trust in between communities. You know, he does the Latinx listening sessions, and he says he's been struggling to get people to try and come and be a part of it and communicate. So there's also a lot of distrust, not just from individuals, but from whole communities. And, you know, that's where it's important to also have other areas, other communities, other organizations come in and do some of that work. And then maybe they could be the bridge between you and those communities. And then maybe over time, those relationships can be built. But immediately, I just don't see that happening immediately because there's such a big distrust. And I think that needs to be built up because for so long there hasn't been a trust like that established.
Commissioner Harder.
Thank you. I would agree with my fellow commissioners who spoke earlier that an arbitrary like 50% cut, any arbitrary or semi-arbitrary percentage point, it logistically does not make sense. It feels unfeasible, and it's just not how large-scale organizations operate. Completely agree with that. That being said, I think that that 50% number came out of the community demands to decrease the footprint of policing. And that may not come with a concrete number, but I think that the idea of reducing the footprint of policing is concrete and is understandable. Because thank you, Commissioner Liza, for that analogy. To further upon that analogy, you know, these lifeguards that we have in this pool statistically are not treating everybody the same, right? Our lifeguards are pulling over Black people at higher rates. We don't have a good way to make this into a pool-based analogy, but our lifeguards are searching and stopping Black people at higher rates. The search yield ratio, which is considered the gold standard for profiling data, that also indicates that there is an issue of profiling. And then, of course, just from testimonies from people like Commissioner Diaz, from people like myself, my father, my family, and every Black person I know in Berkeley, there's racist outcomes in this policing. And so it's not just that we're saying like, oh, 50%, we want to see a 50% cut. What people are saying is that the presence of police and their interactions with police decrease their safety. They are made to feel less safe by their interactions with police officers. And so the decreased footprint is not just something pulled out of the air because somebody said, and I mean like the 50% may have been pulled out of the air due to a comment made in passing, but the need for decreased footprint in policing was not pulled out of the air, and the need for a decreased footprint is not arbitrary. And this data that we have that shows that there are racist outcomes in policing in Berkeley, and these narratives that we are collecting that also corroborate this point, show us that this decrease in footprint is, in my opinion, a necessity. And I believe that that is the underlying ethos of the legislation, regardless of the percentage point that ended up getting put forward.
Yeah, thank you, Commissioner Harger. Wow, a lot has been said, a lot of really good points. I guess I'll just add my 2 cents. I think I've been pretty clear in my comments and not be clear here. I mean, I think the institution of policing is fundamentally flawed. And it's flawed this way because it was designed in such a way to have a disproportionate effect on certain populations. And we see that every day in terms of folks who are of lower socioeconomic status, obviously folks who are of a certain race. And it bears out, obviously, the data we have here in Berkeley, and it bears out in the data we have in basically every department in America. I don't think there's ever going to be a fix to those underlying endemic problems of policing. However, I also understand that to create a safer Berkeley community, we have to have a full discussion. And I think that's in part why we're here. You know, I think the only way a cut would have been arbitrary is if council had just said, okay, we'll just cut 50% today and have no plan of anything, what we'll do with it. Or, I mean, I think that's why we're here. And I know, I hear, first of all, the frustration of some of my fellow commissioners about the process so far. And, you know, the lack of speakers, and I know we'll address that in our next item. But I do think we should be aware that these fundamental problems of policing will not change. They will be with us today. They have been with us 150 plus years. They will be with us 100 years from now. I'll guarantee it. Why? Because we've gone 150 years with these problems. We've had numerous, and I won't get all the history tonight, numerous different task forces, numerous commissions on national levels, on the state level, have these discussions, and it has not changed the endemic fundamental problems of policing, of having a disproportionate effect on certain populations. It's inherent in the institution. And again, that's not about the people, or I'm not saying it's anything about people in Berkeley department, of course not. That's a problem with the institution. To address that problem, we're gonna have to find other ways to cultivate safety. And one of those things is, you know, the safety within policing. And I'll say, Chief Lewis, I've appreciated your honesty and, you know, your restraint and not making, you know, grandiose statements about, oh, if we cut this, it'll be the end of the world. I really do appreciate that, because I think we, at least in my experience, I've heard that too often from, other departments, making statements that, there's no way they could know for sure. So I appreciate really your honesty and restraint in that matter. But I think we have to recognize that in order to make those changes, there are going to be a level of drawback in policing. I mean, that's how you have to reduce that footprint. Of course, right now, and I think this is part of the whole discussion we're having, police are the response for almost everything, whether it's ensuring folks don't run up on the hills to do fireworks, whether it's, finding an elderly person with dementia. Those are all important things we need to have done. There's no debate about that. But the police do all of it. And, I'd argue that there's very few cases where police would be needed, right? If it's life or death, like Chief you described, yeah, perhaps I would want a police officer. I have an unarmed person. If it was life or death, sure, I'll have the officer if it's truly life or death. But 99% of the time, it's not. And to me, that's the area where we have to work in and finding something different. I've written about, safety and its not direct connection to police. And I think it's fundamental as we go through this process forward that, we have the discussion that police don't equal safety. I think that's oftentimes the thought that because police have been this predominant institution in terms of being the folks responsible for all these responsibilities in our society, they're the ones they equal safety. It's just not true. Now, there may be a small component in there that affects safety, but they don't equate to it. And I think we're doing kind of a fact-finding, mission more so to find other components that can fit into this puzzle of creating community safety and reducing harm that aren't the same as the that will have negative effects on certain populations. So I look forward to continued discussion. The 50% is, if you realize it's just not something we have to meet or something we can exceed. It simply was there as a number as a goal. And the goal, it was even premised on the fact that we do the analysis before we even decide what the goal should be. So I think, again, that's part of this process as well. And yeah, I guess I'll stop there. I could go on, but important to recognize that policing, and sure, it's my opinion, but I suggest everyone does their reading, and I'm happy to send folks articles if is endemically flawed. It's gonna target certain populations. That's not about the folks we have as police officers. That's not about Chief Lewis and her full honesty. And I'm sure you're fully a fine officer, the fine chief. And I really believe it. But the institution has problems, and we're here to address those. We'll continue to have that opportunity. And, nothing's hard and fast at this moment. We will get to make those decisions as we go forward. Commissioner Opton. I believe you're muted. Still.
How about now? Am I there?
Yes.
Okay. So I want to urge that we second and third and applaud what the commissioners have said this evening, and particularly what you have said just now, and also what we heard from Commissioner Chima and Commissioner Lindheim. These were very important comments that I hope our Chief of Police will listen to and re-listen to. And I want to focus on the re-listening, because we have to consider that it's her job to defend her department and herself. So as she listens to us, she has to think about, well, what are they saying that's wrong? What are they saying that I could refute, that people should not take for granted, and so forth? It's a debate format, and it inevitably involves the debaters in thinking about how to refute what's being said about them, and that needs to be done. But there may be something in what your opponents are saying that's worth hearing and even important to hear. And so I would urge that our chief of police go back to the recording of this session and re-listen to it, and especially listen to our chairman and to Commissioner Chima and Linton. One valuable way to do that is to approach it from the perspective of, suppose the city council said, we think you're doing great, Chief Lewis, and we'd like you to do more. So we are increasing your department budget by 20%. What are your plans for using that money? How would you use that money? Or why would you say to us, no, don't give me 20% more budget, because we're doing the best that can be done right now, and more money wouldn't make us better, it would just make us more expensive. And in the same session, think about what if a change in the opposite direction occurs, and the city fathers and mothers say, we love you, Chief Lewis, but your budget has got to be cut. So I say 20% or 10% or 15%, some percent. How are you going to reduce your costs? And what do you think the effects of that will be? And you have to do that in from the perspective of neutrality and not defensiveness. And think about what would you do if increases or decreases like that were proposed. And that can lead to creative thoughts in answering the whole charge of this commission to reimagine policing. To reimagine it means to think about what would we do with more money or less money or a different use of money. The chief of police is in a unique position to do that reimagining because she's in the middle of it. And the rest of us are outside. Let's imagine that this were not a police department, but a hospital. And some of the people who go into the hospital are coming out well, but some are coming out in coffins. And some are coming out profoundly damaged, as will happen in hospitals. And I and my compatriots were out there in the street saying, we think this can be done better. We think you should do A, you should do B, you should do C. But we're outside and we cannot see in detail what the particular doctors and nurses and other people who work in the hospital are doing day by day. And we've never been in that position. So there's limitations on our ability to reimagine how the hospital could work. But the chief of medicine of the hospital, she needs to be able to do that thinking. So she is the one, Chief Lewis is the one in our police department who has the ability to think, how could we do things differently? How could we do things differently in small ways? How could we do things differently in big ways, which would mean reimagining? So she is the one who can do it. And the only way to do it is to step back from the debate format, but listen to what people have said apart from one's required response to them, and think about how can I use that information and my knowledge to propose reimagining the way we do our policing. Thank you.
Thank you, Commissioner. Any other comments on this item, Commissioners? If not, let's turn to. Did we lose Tano, or is he?
There's no raised hands, Chair.
Okay. All right. In that case, let's go to our last. We have a hand.
Oh, apologize. Someone snuck up. I will bring Andrea Pritchett in. Andrea, you should be able to speak.
Thank you. I guess I'm sorry I wasn't able to be present for the whole meeting, and I just wanted to check in on your process and so forth. But I did want to mention that we've been hearing a lot about the presentations that are being made by the police and the studying of the police and this notion of reimagining police. And I think it's interesting that there's debate in the community about whether or not we're reimagining policing or reimagining public safety. And I would be interested in knowing which meeting will give me some clarity on that topic. So we're just wondering how the community is going to be centered in this. We talk about this notion of marginalization, and it looks like most of the folks that I know are on the margins of this process. So any clarity that you can lend, any message that I can convey, I'm happy to do so if it lends clarity. Thank you.
Thank you. Okay, in that case, thank you, Interim Chief Lewis. David, do you have something?
No, I was just saying I don't see any. Did someone else raise their
Well,
hand?
we have another hand.
Carol raised her hand. Sorry about that, Chair.
No problem. Here.
Carol, you should be able to speak now. Carol, my friend, you're on mute. Looks like you're off mute now. Carol, do you want to try to do your phone again? It worked before. Sorry, Chair. We can't hear her.
Okay.
I'll text her. Why don't we move on?
Okay.
And then she.
Thanks, Buna. And yeah, so thank you, Interim Chief Lewis. Yeah, I want to stress again, I really do appreciate your candor, honesty, and restraint throughout this process. And of course, Fireman will continue to be a stakeholder and partner in this process. So yeah, thank you. And yeah, we'll move forward.
Thank you all very much.
Alrighty, to our last item, I believe, items for future agenda. Are there any thoughts, proposals for Mr. White?
We just want to confirm, it's already been raised at this meeting that we will be scheduling a meeting on July 29th. We didn't have that as a separate agenda item, but we wanted to make sure it's clear that Shamik and I'll be working to put together an agenda, and we're hoping to have some of the items we talked about earlier from the National Institute for Criminal Justice Reform at that meeting.
Okay. So yes, I think we really should have a meeting scheduled that day. Do we need to do anything? I mean, I think technically I have the power to do special meetings myself, but yes, meeting on the 29th. Thank you. I think Commissioner Harger.
Thank you, Chair. So I think that something we've been hearing from a lot of community members and also from other people in this commission is that we've heard a lot from the police department, we've heard a good amount from NICJR, and we've heard almost nothing else throughout this process. And I feel like we're pretty much at the halfway mark. We've already learned a lot about the police department. We've gained from these presentations, but we also have large blind spots. One of the things that comes to mind for me is, as Chair Mizell was saying, racism is built into policing because policing was created to enforce racism and enforce racist policies. And that's something that I am very clear on. It's clearly something that Chair Mizell is knowledgeable about, but it's not something that we've discussed as a body. We have in no way broached the history of policing, and I don't think it's possible to talk about the future of policing or public safety without understanding its history. That being said, the University of California, Berkeley, as well as UCSF, have fantastic professionals, scholars, and thinkers who work specifically on the topics of policing, the history of policing, the sociology of policing. And I think it would behoove us to have somebody who can come and talk to us about this history in this context, so that we as a body and also so that our greater community can have a better understanding of what's undergirding this process. So that's one thing I think would be really beneficial for us to get somebody like that to come onto our agenda. And I have some names in mind, but obviously this is a very smart group of people. I'm sure we can come up with some other names as well. Secondly, I think we've heard about the police review process, the PRC process. We've heard about how there are very few sustained complaints, but we have not heard about what it feels like to try to file something through the PRC, and we don't know that perspective. And I think it would be really beneficial for us to gain narratives from people who have tried to gain accountability from this police department, or who have faced harassment or violence at the hands of this police department, because we've heard absolutely nothing like that. And I think that there are many community groups that we could reach out to. Off the top of my head, I think of the Berkeley Community Safety Coalition, who would be able to find people who have these narratives, who are willing to share with us. So that's my second point. And then my third point is we've heard a lot about the police department from the police department, but we have not heard about the police department from any other perspective. I believe that Berkeley Cop Watch could give us a good perspective. They've been collecting data on Berkeley police since the 90s, and they have a pretty extensive database of police interactions. So I think that getting that information would also be very beneficial. Essentially, what I believe is that this process right now has been pretty one-sided in terms of the information that we're getting in these meetings. And I know that I myself and many of the other commissioners have been supplementing this process without external education. But I think that we should try to have this as centralized as possible, because of course, this is not just a process for us as commissioners, but for the community as a whole. And so I think it would benefit all of us to have this kind of diversified agenda and increase access to information.
Yeah, thank you, Commissioner.
I just want to make sure.
I just want to say I fully, go ahead. Sorry, David.
I just want to make sure everyone understands, it's totally working through the chair. Anyone on the task force can, just like Commissioner Fine brought forward an item for the task force, all those are wonderful ideas. And so we would encourage you to work with Shamika and myself and work through the chair and vice chair. If you have a particular person or a particular group that you want to come and speak, the chair is really the arbiter of what goes on to the agenda. So we will be happy to, put whatever that topic is, and you absolutely have that opportunity to do that. That door is always open, and we're happy to, do the administrative side of it for you. But, it's perfectly acceptable and wonderful.
And I was just
Carol is having technical problems, and she's going to send out an email to staff to just share her comments in writing.
Thank you. Yes, I was just going to say, fully support that, and of course, come from any other commissioner. Suggestions of other folks, other community groups we should be hearing from. In terms of my responsibility, I will apologize for it have taken us this long into the process to have a more robust conversation with other stakeholders. I think partially for me, it's been that reliance on my knowledge externally and through other means of kind of knowing broadly how some of these things have functioned. But I know does not help the full commission or the full public. So I'm glad we're now having this conversation. Please feel free either by email or, to David, Shamika. I know Buna would be happy to hear as well. If you have any thoughts on folks we should be hearing from. Commissioner Lindheim.
So I just have a sort of more general question is how we proceed from here. I agree with most of the prior comments. With one exception, I don't think we've really engaged with the consultants. I really have no idea what they're recommending. What we've received so far is their sort of guidebook to what some other departments and some other ideas have been and may or may not be, but it hasn't been in the sense of recommendations that we need to consider or should consider or might consider. I don't know that what they're going to come up with is worthy of consideration? It might well be. It might be fantastic. It might be something less than that. But to the extent that the city has invested a substantial amount of money in the consultants, I think we pretty soon in the process should engage with what they have to say. And if we think it's not worthy, then that's fine. If we think it's partially worthy, that's fine. If it's fantastic, that's fine as well. But at this point, I don't think we have a clue. And so as long as that process is going in a parallel way with what we do, I think at some point we need to engage. That's number one. Number two, somewhere in this process, I hope we all can engage with each other. We've really had barely any conversation or arguments or discussions with each other about what we think about all this. We make independent comments, and some of them are expressing our heartfelt views, and sometimes they're just comments trying to elucidate responses from some of the people who are making presentations to us, as a way of just drawing them out. And so, I'm not clear what everybody else on the commission thinks about a lot of these issues. And I think it goes vice versa. I don't think people necessarily know what I think about some of these issues, and that's fine. But at some point, I think we really need to get into it and really make our thoughts and views clear to each other, and see where we agree and see where we disagree. And if there's some of those issues are factual differences, then we can respond and dig up some more facts. If they're just different approaches, then that's just, so be it. That's just what it's going to be. I think so far we've been sort of bludgeoned with presentations. And I hope at some point soon we get beyond that and really start engaging. But I just didn't know when that's all going to take place, and hope that that's being considered somewhere, because it's still somewhat mysterious to me. So that's my comment.
Commissioner, do you have any, I guess, specific suggestions to how to broach from now really presentation based to more conversation based?
Well, I think at the moment, to the extent that the consultants are going to come up with something with recommendations soon, and I was unclear from the earlier conversation whether they are going to have something in time for our next meeting or not. That didn't seem clear to me. To the extent that they will, that I think that would be the first opportunity to at least engage with them. And then once we have a clear idea what they either have to say or don't have to say, or what we like about what they have to say or not, then we can then start, engaging with each other and to find out what holes there are. So, I don't, at the moment, I do want to hear what the various consultants have to say about things, and then from there move on, because ultimately we're going to have to make our own decisions about what we think about all of it. But I don't have other recommendations at the moment as to what other presentations I want to hear from. I can think of lots of things, but I don't think that's appropriate at this moment.
Thank you. Commissioner Fine.
Yeah, I've been thinking about this for the last few weeks, and what I've thought about is not even, we've heard so much in terms of models and practices and so forth from the consultant, or we've looked at the 15 different types of non-police crisis response. But the more I think about it, I'm like, why aren't we thinking more on a global level? And what I mean by this, I earned my master's in criminal justice and human rights in Belfast, Northern Ireland. And I went there because basically there was an unofficial civil war in the 1970s between the Catholics and the Protestants. It was structural oppression. And I wanted to try to understand policing in a context that was decidedly different from this country. And I feel like, we should pull in, like, I don't know if that's the example to pull in somebody, but I feel like we need to have a conversation like, Alicia, you were talking about maybe somebody from Berkeley and maybe looking at some other countries who do community policing, because there is definitely a lot of rich scholarly or even community-based. I mean, there are different kinds of models and practices that we can look at. So I just want to put that out there.
Oh, thank you, Commissioner. I mean, one thing I think that I could try to do is, I have certainly not as many as, former Christian Paris fellows, but some contacts in terms of NACO, which is the National Association of Civilian Oversight of Law Enforcement. They deal, primarily actually the oversight component, but I know they have folks actually from other countries who do that type of work and have, exposure to how other police departments, other countries operate. So yeah, I can, on my end, just reach out and see if any would be available to us. Yeah, but no, I think that's a great idea. Thank you. Vice Chair Chima.
Earlier on, one of the commissioners, it was great comment, was we're only getting half of the story. In a community, there are services and supports for people so people can thrive. We have been concentrating on the services of BPD and ignoring, nobody's talking about community-based organizations, but nobody's also come to us and said, these are the organizations that are working in the field. This is what they do. And if they were to do a little more of this, then a little less could happen. Would be there that, the same statement we've all been making. I think a presentation, and I can really help, and Dr. Barhouse, if she's listening, we have those reports. We have, oh my gosh, we have a lot of data and a lot of reports on what each organization does. For example, Dorothy Day House more and more acts like their multi-service center is an SCU without wheels. So there are things people are doing that the same. And I think that conversation with either CBOs and the entire task force, or that we need to know that piece as well as we're beginning to learn as to how many people it takes to do what, because they go hand in hand. The more we have in the community that with trained people to do things that are not related to crime, the less, we'll have to do some other way or some, I'm not even making sense to myself, sorry. Do you folks get the point? That we don't have that knowledge of our own community this far into the process that is about public safety. Public safety wasn't ever meant to be just about police and police budget and cutting police. If we read the language in the legislation, there's a whole chunk of public safety means youth programs, it means this, it means this. I think we better get to that piece pretty quickly so we can figure out, what can go here and what can be added here. Where can the partnerships be? And I come from a time when collaboration between BPD and the community-based organizations very, very close. And also at times where they weren't. But there were at least these conversations that we were having with BPD. And we're not having those conversations. The ride-alongs are great, but just in the way we haven't heard from our police officers, we will on the ride-alongs, we also haven't heard from people who are providing the services that we're saying SCU will provide. So it's more than just a two thing, cut BPD, reinvest in community. But to be able to reinvest in community, we need a deep knowledge of what it is that the community still needs. After Berkeley spending some $40 million, if you add public health and mental health and all those different divisions, and we're spending a lot of money on services, and and not everybody is doing a perfect job. And yet in Berkeley, for any community-based organization to be cut, and staff has tried to do that many times and learned the lesson that it won't, because the community shows up and the council person that represents that district where the program is. I haven't seen cuts in community-based organizations in the longest time because there's no analysis of effectiveness or the cost. So if health went up 15%, CBOs are going to be saying, gosh, if our health goes up 6 or 7 or 8%, we're going to have to cut. So that conversation where we find out about who the service providers are in our community, what they do, how effective they are, I think is the half that's missing for me. Because I don't want to cut from one place and give it to another place, and they don't have the capacity to do that. And then where we cut from, that they're asked to continue to do, what they were doing before we cut them. We just, it would be great to kick up these meetings and conversations to, a higher level of dialogue, discussion, agreements, disagreements, something much more robust. And I think, Nathan, you could ask probably for a special meeting. Staff would probably have to be there, but the only thing on the agenda is our conversation. And in consulting with our subcommittees, we can come up, without breaking the Brown Act, we can come up with an agenda for our conversation. Thanks.
Thank you. Certainly we will discuss that. Okay. Any other discussion on items for future agendas at this moment? Seeing none. Mr. White, looks like we have one hand for. Oh.
Sorry,
I'll
I
take care of it.
When our September meeting is, I know we said we're going back to a regular schedule. I've forgotten what a regular schedule is. Is it on the
Second Thursday of the month.
9th? Okay, it's on my calendar. Okay.
Yeah, September 9th, I believe.
8th or 9th.
8th, I think.
Okay.
And did we say already what the agenda item for 29th would be and what we might expect it to be for on the 9th? Do we have any ideas for what it is?
From a staff perspective, the only thing we offered was possibly bringing in our interim director of police accountability, Kathy Lee, to talk about the new oversight body that was put in place with Measure II, and then the reports from National Institute for Criminal Justice Reform surrounding the alternative response report, and then potentially we'll see how it goes around community engagement. But again, that's subject to the chair approving those items on the agenda.
Great. Thank you. Yes, seeing no other comments on this item, looks like we're ready to move forward to adjournment.
Chair Mizell, we have one public comment. Did you want to address it?
Yes, let's go ahead and hear from them.
Phone number with starting with 757. You should be allowed to speak now.
You're
Hi, I'm
muted.
unmuted now. Am I
Yes.
unmuted now?
You are,
Hi,
yes.
my name's, thank you. And thank you for taking my comment late. My name is Mary Ann O'Sullivan. I live in West Berkeley. And that kind of, underscoring some of the comments that came at the end of the meeting about how much we've been hearing about policing and the details about how police are doing their work. And I'm a white middle class woman. And I think that, the way the police look at safety is my safety, and often at the expense of the safety of people of color in my community, and especially Black and brown men and boys. And so I think it would be fabulous, and you're always saying this now, but to shift the conversation to what does safety mean? Like, what does safety mean for me and for the people that I live around in my community? And I'm not going to be safe until the people of color around me are safe. And that means education and healthcare and jobs and restorative justice. And I think it means talking to people like the Berkeley Public Safety Coalition and Berkeley Cop Watch and Lifelong Medical and the faith leaders in the community who have been, spent their lives on this stuff. So anyway, just wanted to encourage that and thank you for listening.
Thank you. Commissioner Hyde?
Sorry, trouble unmuting myself. Thank you. I just wanted to add in the thought that if we're working on the 729 agenda, and it sounds like we don't have firm stuff on there yet, but there's a few things up for discussion. I think Commissioner Harger's suggestions, plural, she hit some really good notes about how to flesh out the conversation and there's not only two sides to this conversation. There's lots of facets and lots of sides, and some great suggestions were made. And I wonder, can we specifically put on some of the main groups? And I really liked Alicia's list of suggestions, but there were others. Can we firmly put on some of those other additional sides of this for us to think about as we get into a more meaty conversation? Can we do that for 729?
I think we can, and yeah, I look forward to having the conversation, and I don't say that in like some theoretical sense. I really want us to have other folks, as soon as we can. So next meeting.
You need anything from us, from your fellow commissioners? Do you need anything from us in order to get the list together and get these folks into the 729 meeting?
I'd love. Obviously, first just names or organizations, and then if you have knowledge of their basic expertise, or if they willing to shoot us an email, that would be very helpful. Just so we know where to best fit them in.
Margaret and I created that list. Remember that had 120 organizations,
Yes,
and then
yes, you did.
And we added, because the city didn't have a list with people's contacts, or it was protected by something. Then we filled in all their website, the phone number, and in many places the executive director's name. So it's the it's the list for right now until we go back to improve it. So Margaret and I can go through that list, and we know the groups that we're all talking about, and send Alicia that list, and then you add to it, and we forward it out to the our little agenda chair committee, and then send out the invitation to those folks. But I won't need to hear from David in terms of, do we think an hour would be enough? Do we think two? I don't think that conversation is a 4-hour conversation in one night, because it's going to be a lot of information. But what I'll start doing is start sending out other task force reports, reports around demographics of who's unhoused, some things that we can at least slowly start to get familiar with what it is that our community provides.
Thank you, Buna. Commissioner Harger.
Between Margaret and me, we can send you almost anything we need.
Yeah, definitely. I would appreciate getting that list just for general purposes because you guys put a lot of amazing work into it. It's a fantastic resource. I really appreciate it. And in terms of the people that I listed, I spoke with the chair and I can reach out to CopWatch. I can reach out to the Berkeley Community Safety Coalition. I can reach out to a couple academics. So I can do the legwork for the 3 things I listed. But of course, we have so many community organizations. So please do not just stop at the ones I listed.
Great. Thank you. No, thank you all. Okay. Any other comments at this moment? And let me look at public comment one more time. Okay. No one. Great. Yeah, let's go ahead and I'll move to adjourn.
I second. I second.
Noted. Thank you. Roll, Chair Marcel?
Yes.
Yes, thank you. Fine.
Yes.
Ejigu?
Yes.
Vice Chair Chima?
Yes.
Lake?
Yes.
Linheim?
Yes.
Dangerfield?
Yes.
Gauche?
Yes.
Hyde?
Yes.
Mizell, Chair Mizell?
Yes.
Optin?
Yes.
Harger?
Yes.
Diaz?
Yes.
Lutzker?
Yes.
And Commissioner Ho is absent. Thank you. Motion carries.
Thank you. Good night,
Everyone.
everybody.
Good night, y'all.
Yeah, have a good night.
Good night.
Good night.